Hi, Mark.
That's me.
Hi, I just want to, sometimes my audio doesn't work. I just want to make sure it was working okay. Thank you.
Not too bad. Yeah, no, you can be heard. That's great. Welcome.
Hi, Mark. How are you?
Good evening, everybody. We've got a long way to go here. We have 8 panelists, and I think there'll be a total of 75, so we'll give them a chance to join.
Hey, Mark.
Hey, Rich.
You got it working?
Got it working. Thanks, though.
Mark, do you have an order of speakers at this point?
Yes, I do. Unless I'm very much mistaken, we'll be going in this order. It'll be DHS, followed by the service providers, followed by Inspector Yaguchi from the 24th Precinct, who will be speaking on behalf of both the 20th and the 24th precincts. Then, depending on time, Principal Monica Berry from PS 87 needs to be on a call having to do with the reopening of schools, which I'm sure is as thorny an issue as this one is. So I may take her out of sequence. Then remarks by elected officials, and then we'll go to the stakeholder groups, which will include Goddard Riverside, the Upper West Siders for Safer Streets, the Open Hearts Initiative, the West Side Community Organization, 2 block associations, 2 faith leaders, a co-op condo board, and then Mark, you're going to bat cleanup.
Okay, sounds good. Thank you. Good
then
to know.
if there are any questions of fact in there, we will repose them and give DHS and the service providers a chance to answer them. Then we'll turn to questions that were submitted in advance from the community.
And what faith leaders do you have speaking? Is that Kay?
I have Kay Carpin from St. Paul and St. Andrew, and Rabbi Lauren Herman from SAJ prepared a statement that a parishioner or a congregant of hers will be reading.
Okay, great.
She's unable to be with us.
Thank you.
Okay, 15 panelists, which is great for a normal night, but way below where we should be. So, but we have a few minutes left. Hoping that everybody joins on time. We've got a long agenda. There's Christian.
I'll be back in about 3 minutes.
Very good. You got time.
And Mark, we can't see if any panelists joined as attendees.
Well, there are 2,286 attendees according to Zoom. So I have no hope of being able to find them.
Yeah, that's a good point.
If they're attendees and they meant to be panelists from the community board, maybe they could contact Rich or Christian by phone. I mean, by email.
Yeah, they can.
Probably by text would be better, but yeah.
Yeah, they can. Yeah.
Mark, are we broadcasting live yet or waiting for 6:30? Maybe the attendees will populate at 6:30?
The attendees will populate when I hit start the webinar. And then, yeah, okay. Which I will do shortly because it's 6:26 and it's going to take a while for 2,000 people to join.
Yep.
Do we have names of the people from the service providers or DHS?
We have some
sure.
names.
Sure.
I'm just thinking
sorry.
Jerry and I should have them so we can be on the lookout if we need to.
Okay. Well, I should have thought of that before. I have them, but I can't share them with you very easily.
I have
Yeah, don't worry about it.
I have a short table with the list of the people that were on the agenda.
Very good.
Christian,
Yeah.
I have a list of all the people who participated in the previous. I can just send that to you by text?
If you can send that to Christian and to Rich, that would be great. All right, I'm going to hit start webinar. So now the attendees should start popping in. Let's see how it goes.
I don't think you have to wait for 2,000 people. I think at a certain point you can start.
Yeah,
But we
well, we're
start-
not there yet. But,
We just crossed 250.
yeah, we're already at the biggest meeting we ever had. So
Okay, Rich, I send you the that short list I have.
Yeah, great.
You're such a celebrity, Mark, that they all want to come on.
Shelley, I'm in enough trouble as it is. I really don't need any help, but thank you
I'm
very much.
sorry. I'm sorry.
We have the first hand raised already.
Wow. What happened?
I'm back.
The number keeps going up.
The attendee number is going up, but the panelist number is crawling.
Well, it's up
So-
to 32.
Yeah, but we need like, there's like 70 of us.
Is that even counting all the CB7 members?
That would include the CB7 members.
All right, we're plus 500 now.
This does have a certain Houston.
Hi, Gail.
Hi.
Hi, Mark.
Hi, Gail.
Hello, everybody.
Right, first mission success is we've passed 500 and we're still live.
Thanks, Rich. Really appreciate it.
Yeah, yeah.
It's not me, it's you, Gail.
Oh, no. We did get you extra. We got you extra support, though.
You did. I'll mention that in a minute.
No, you
It's
don't have
just-
to. It's just, I was insistent on it because I know what it's like.
Well, we're grateful. I'm going to give 2 more minutes in hopes that the panelists all join, and then we're going to get started. Because we got only 2 hours and a lot to cover.
Since we have Dead Air and Gail's here, not only thank you to you, but also to Noel, who's been fabulous.
No, it's not.
Rich, you're stealing my thunder.
Hi, Mark.
I'm an old DJ, I hate Dead Air.
Okay.
Actually a DJ, Rich?
Remember that we are recording and live.
Hi, Mark.
Hey, Jay.
Great job.
Well, great. We'll just call it a night and go home now, right?
You got it.
Quit while I'm ahead. All right. It is, nope, that's not.
Hey, Mark.
Hey there, whoever that is. I'm sorry.
Brad.
Oh, Senator Hoylman, I didn't know you were going to be with us. Okay. We're at 850 attendees. God, I hope they can all hear us. All right, good evening, everybody. My name is Mark Diller. I'm the chair of Community Board 7. Welcome to our information session concerning the use of local hotels in our district for the protection of homeless shelter clients who were housed elsewhere to protect them from COVID. I will lay out just a few things in advance here. The purpose of this meeting is for the public to hear directly from our from the Department of Homeless Services and from the service providers in 3 of the hotels on the decisions made and the operations underway and how that all works. We are completely grateful that they have agreed to participate in this information session. I'm hesitating to call it a meeting because really it's intended for an opportunity to share information and to have questions answered and comments raised. We have 2 hours and far more to cover than that could possibly handle. So I'm going to be moving us along as best I can, and I'm going to be as tight as you've ever seen me about timing for everybody. And with apologies to our wonderful elected officials who have joined us tonight, a couple more than I had anticipated, which is great, and I thank you for that as well. But we're going to ask everybody to keep it to 2 to 3 minutes, other than the DHS and the service providers, because we're here to hear from them. That's how this is intended to work. So I hope I can count on everybody to find that soul of wit, which is in brevity. I am going to take a little bit of chair's privilege here just to do a couple of things. First is that the purpose of this is to be to have a productive exchange of information. We're going to do our best to find solutions to things and to chart a path forward that is productive. This is in direct response to the community's request or need for information, and that's what we're trying to solve or to supply here at Community Board 7. I am grateful, as I said, to DHS and the service providers for coming here. I'm also grateful for all of you for making the time to be a part of this session. I want to lay out just very quickly how the evening will go. I'm going to, as soon as I finish talking and thanking just a couple of people, we're going to turn to the Department of Homeless Services. I'm going to ask, while I'm doing this, I'm going to ask Christian and Rich to make sure that we have muted everybody. We will then unmute the people who are going to speak, and that's how this is going to go. There are currently 1,000, well, between panelists and participants, we're at 1,100 people and counting. So this cannot be a town hall. I can't pass the mic around. We'd be here till Thanksgiving, and even then probably have folks still waiting. I also asked for questions and comments via email, and I thank you because I've received over 165 separate emails, many of them with multiple questions. And so we have compiled them into categories, which I will read once we get to that part of the meeting. But first we will have, as I said, DHS, the service providers, NYPD will speak. I hope that we can find Deputy Inspector Yaguchi, the commanding officer of the 2-4 precinct, on the list, and we will hear from him. We will then hear from, let's see. We'll then hear from, depending on time, Principal Monica Berry is with us from PS 87, one of the schools closest to two of the shelters. And I know that she has other duties with respect to exactly how it is that we're going to reopen our schools, or are we, or are they inside or outside? So with apologies to the order of speakers, we're going to turn to her earlier on than perhaps the other stakeholders. We'll then hear from our elected officials, as I said. And then we will go to a series of community stakeholders, again, 2 to 3 minutes. And we will ask them to use that time on this subject. There are about 8 or 9 of them. And then we will give DHS an opportunity to respond if they choose, or if there's a question posed in those community stakeholder questions and comments. If there's something to respond to, we'll give them that quick chance to do it, and then we'll turn to your submitted questions in advance. Because we had so many questions submitted in advance, and because they all seem to fall into a handful of categories, we are not going to be able to take questions from the chat as well tonight. I apologize for that, but it's simply a logistical impossibility. What we will do is save the chat. We will review it in the next day or two. We will make sure that any question that was not already answered by the previous questions and answers is submitted to the right party, and we will work out a way to make sure that those answers are posted or shared in a way that makes sense. We sort of have to wait and see exactly how that works. Please allow me to thank a few people with respect to this. First and foremost is Borough President Gail Brewer, who among other things expanded our license so that so many of you could join us tonight. Without her, we would have to cut this meeting off at 500 people, and that really wasn't in the spirit of the meeting or the event. So we are grateful for both the funding and the forethought. Right behind Gail, we want to thank Noel Hidalgo of Beta NYC, who's actually the person who's the tech guy who figured out how to do that and got it to work, because Zoom was, I don't know if anybody noticed that Zoom was actually down on the entire East Coast of the United States today. So unraveling Zoom is no task for the faint of heart. So we're grateful to Noel. I am personally grateful to April Adams. I know it's a mistake to call out one staffer among others, but April Adams did yeoman's work in making sure, she's with the Borough President's office, making sure that I had all of the contact information and the opportunity to reach all of you. And then I have personal gratitude to Rich Robbins, Christian Cordova, and Doug Kleiman. On his birthday, he is spending it helping us facilitate this conversation. They are my co-hosts. They'll be the ones unmuting you and looking for the correct things. I will not be able to unmute anybody in attendees, so I'm sorry to say that raised hands will not be answered among attendees. With that, I am ready to begin our evening's program, and I call on the Department of Homeless Services. I believe Erin Drinkwater, are you the first to be speaking?
Yes, I am.
Thank you. Welcome to Community Board 7, and thank you for your participation in this evening.
Thank you, Mark, and thank you to the community board, to our elected officials, and to everybody participating this evening. To have, over 1,000 participants really says something in terms of individuals wanting to get information about the work that the city is doing to protect vulnerable New Yorkers, and also learn more about the services that we're providing. My name is Erin Drinkwater. I'm the Deputy Commissioner for Intergovernmental and Legislative Affairs here at the Department of Social Services. I'm joined this evening by 2 colleagues, by the Manhattan Borough Director, Leilani Irvin, and our Associate Commissioner of Adult Services, Yvonne Ballard. I also want to take a moment really to stop and acknowledge all of the staff of DSS, HRA, and DHS, as well as all of our contracted providers who are represented on the call this evening. They've really been at the front line of the response in terms of providing programs and services, and really making sure that New Yorkers who have no place else to go really are connected to essential services during this global pandemic. If I can, I'd like to take a moment and sort of walk the audience and participants through the work that DHS has done over the course of these past couple of months to contextualize the conversation that we're going to have. I think it will provide some information and possibly answer questions that are coming. And so want to, make sure that we're starting from a place of a common understanding of the response that the city took. We started very early on when we were learning that this pandemic was unfolding, of really working with our colleagues at health and hospitals, at the Department of Health and Mental Hygiene, utilizing CDC guidance to determine how to respond appropriately to protect New Yorkers who are in shelter. Our shelter system is made up of different systems. Our families with children's shelters are largely apartment buildings. Individuals can isolate and are able to really protect themselves during COVID. Similarly, our adult families, these are cases who it might be a mother and adult child, it might be a mother and a grandmother. Those two are individuals who are typically housed in facilities that are called tier 2 shelters. Individuals are able to appropriately social distance in those locations. That is unlike our single adult system. Our single adult system makes up approximately a fourth of our system and is dorm style layouts for the sleeping arrangements. There is congregate meals and recreation area. And these spaces are the ones that we focused on as it related to the relocation and consideration for the use of what we call the dedensifying hotels to ensure that we were protecting the health and safety of our clients. Our planning really began all the way back in February, but some of the work that was known to the public didn't really start until well into March. In the beginning of March, we started disseminating information to our providers to make sure that they had the latest from our health experts, DOHMH, et cetera. And in mid-March, we opened our first isolation capacity. This capacity allowed us to take individuals who either had tested positive for COVID or experienced COVID-like symptoms. If we can rewind our memory a little bit, if you remember very early on, we didn't have access to testing. And so we had to use a symptoms-based approach and a presumed positive to really make sure that we were taking care of the totality of our shelter system. And so that meant if individuals were presenting with symptoms, we were able to remove them from those congregate settings, place them in an isolation hotel until their symptoms subsided, thereby making sure that we were treating them as well as the shelter system as a whole. At the end of March, we started weekly commissioner calls with our electeds, our CBO partners, and our providers. Those calls continue each week, every Tuesday. And following those calls, we send out an email summarizing updates that occur each week. And this is across both the HRA system and the DHS shelter system. And back in April, very early on, the New York Times credited us with the transparency in our reporting. Which we were very proud of because we think that transparency is important. We then continue to provide PPE as we gained access to supply chains. Again, if we go back to March, the situation looked very different in terms of accessing the things that both our providers needed as well as our clients. We were able to secure PPE, we were able to secure cloth face coverings, and making sure that that is provided to our clients. Towards the end of March, on top of in the beginning of April, in addition to the isolation capacity that we set up, we started dedensifying our shelters, moving individuals into commercial hotels. We started that effort by focused on clients who were over 70, and then we continued that exercise, moving individuals into commercial hotels. We've utilized approximately 60 hotels across the city. The conversation tonight is focusing on 3 in the area of the Upper West Side. There are 4 commercial hotels that we're utilizing in CB7, and as I said, 60 around the city. We worked to initiate these transfers as quickly as possible. We entered into a contract with the Hotels Association of New York, so that way the agency could focus on serving our clients. And we worked with providers to match them to hotels based on the size of the shelter that they were serving and how they were going to move those clients into the commercial hotel. The provider also, it's not just moving the clients, they also moved their program, their social service staff, their security staff into the hotels as well to make sure that our clients, irrespective of where they were located, still had the availability of case management, of housing specialists, of connections to mental health, to telehealth, to substance use counseling, and those sorts of things, as well as the opportunity to continue to engage with staff. We had meal delivery to make sure that our clients had access to food. We also continued our work on the streets in terms of ensuring that individuals who are experiencing unsheltered homelessness also had access to information, to PPE. During what was the colder weather months, we were able to make sure that clients had access to things like socks if need be. In the hotter months, we've made sure that they have access to water. One of the things that I think you and I might not be so attuned to, but the public spaces and the ways in which individuals use spaces has changed very significantly during the COVID outbreak, right? So many locations were closed, whether they be gyms or libraries, coffee shops, grocery stores, all types of things. Well, not grocery stores, those are essential, but all types of things were closed during COVID. And it meant that the places that you or I might frequent and our clients at DHS might frequent, those no longer were available. For example, bathrooms. Oftentimes clients will use bathrooms, in public places and coffee shops and McDonald's, those sorts of things. Public bathrooms became a very challenging thing for clients to access. We recognize that, and the city actually put out a number of porta potties and mobile hand washing stations to address this. We recognized, especially with clients who are experiencing street homelessness, to have access to that would be very important. Unfortunately, we had to remove those after being out for a number of weeks because they were vandalized despite daily cleanings and things like this, and ultimately did not serve the purpose that the city had intended them to serve. Today, we've made sure that our outreach staff are informed on the locations of public restrooms that are available to ensure that clients who might be on the street know where to access those locations. In addition, DHS never closed down what are called our drop-in centers. Drop-in centers are a critical tool for our street outreach team. They allow clients to come inside, to utilize the restroom, they can take a shower. These are not sleeping facilities, but they do allow a client to connect with staff and continue to build that trust. So that way, ultimately, we can get them connected to services and bring them inside and no longer remain on the street. So all of that, it was part of our response. The hotels that we're speaking about tonight, we began utilizing 2 of them in May and then 1 in July. This required a staggered response as we had to move clients out of the congregate locations into the commercial hotels. So that way we could, as we were moving, work to also ensure the safety of our clients, as well as the staff and everybody else who from the program teams would be moving along with the clients. To date, as of August 18th, we tracked 1,428 positive cases over the course of the past 4 months. Of those, that included 130 cases that were referred to us from our agency partners. And of those, there are 16 cases within that remain positive, meaning they haven't met the threshold and health criteria for resolving the case and considering that case closed. Of those 1,428 positive cases, that includes 104 deaths, which is tragic. But we know that by moving New Yorkers into the commercial hotels, we were able to save lives. We acted with urgency. We acted with the priority of our clients and our provider staff in mind, our essential staff who showed up to work each day. And we've been working with our communities to address issues that some of you have raised, that have been raised through the community board, that have been raised directly with providers, and are glad that we've had the opportunity to have a couple of stakeholder meetings where we've heard from our elected partners, from community boards, from BIDs and other stakeholders in the community, and then to be able to respond to some of those things. I know that each of the providers are going to have an opportunity to speak later, but I wanted to give a couple of examples of the things that we've been able to respond to and that I think are important. So we've been able to give contact information at the sites. We've been able to remind people that if they see somebody who is experiencing homelessness and they're interested in getting some assistance to that individual, to call 311. So that way our outreach teams can be deployed. We have regular canvassing that occurs on the Upper West Side by Goddard Riverside through our Manhattan Outreach Consortium. The locations in and around the 3 hotels that we are using for our de-density efforts are canvassed regularly, multiple times a day across multiple shifts. So when you call 311, that's in addition to the regular canvassing that's occurring in these locations. We've also been able to, through the conversations that we've had these past couple of weeks, remind our hotels staff, or the provider staff, that if they see somebody who their teams are trying to engage and it turns out that it's not from one of the hotels, that they're able to call our Joint Command Center to ensure that DHS responds to make sure that we get a team out to address the needs. We are working in a new environment in our outreach world. The most recently passed budget made some changes to the NYPD's budget and the ways in which the NYPD had historically worked with our outreach teams. The homeless outreach unit was disbanded, and we now are very much focused on ensuring that we're leading with our social services tools, that we're working with clients to engage them, that we continue to focus on meeting the social services needs of our clients rather than using a heavy-handed enforcement tool. We continue to work with our Department of Sanitation in terms of addressing cleanups and issues in which debris has accumulated in an area. Again, we continue to work directly with the client. DHS's responsibility in a cleanup is to ensure that if an individual is willing, that we have the resources available for them to come inside. And so that work is continuing as well. I see that there are some items in the chat, and so I want to make sure we give our providers an opportunity to speak. I know we're going to get into the questions. I'm not ignoring them. They are popping up, which is a little distracting, but I want to make sure that we save time for the providers and then be able to dive into questions. No matter how many times we do these Zoom things, it still takes a little bit of getting used to. So thank you for your time and attention, and I'll turn it back to the chair.
Thanks so much, and thank you for your presentation. Before I turn to the service providers, and I'll be calling on project renewal first, so perhaps we can unmute Eric and whoever else Eric designates. I want to have a couple of other housekeeping notes. One is the purpose of this meeting is to hear from these folks and to have them answer our questions. So the 2 to 3 minute rule will not apply to them, although I encourage everyone to be brief. So please let us listen to the folks that we're here to listen to. The second thing is that I'm noticing a lot of folks using the Q&A. The Q&A will not be preserved. The chat will be. So if you have a comment or a question that you want to make sure is in the record of this meeting, the way to do it is via the chat. We will be dismissing the Q&A at the end of the day, and we really don't have time to do all of these different functions within Zoom at the same time. So that's how we're going to run the meeting. Any objections or concerns about how this meeting is run are solely mine. I've been given great help, and so if I haven't followed through, that's on me. But let's now turn to Eric Rosenbaum, who is with Project Renewal, and anybody that Eric wants to turn to instead.
Thank you and hello. I'm Eric Rosenbaum and I'm the CEO of Project Renewal. I'm also your neighbor. I've lived on the Upper West Side for 23 years in an apartment I own just 5 blocks from the Lucerne. I've seen the changes in our neighborhood over the past 2 decades, and I've seen the changes in the past 6 months. It's a really tough time, and I and our staff are committed to working together with all the community leaders here to help our neighborhood and all of New York recover. I'm joined here tonight by my colleagues Kadon Grinnell, Vice President of Programs, and our Director of Security, Charlie Mullum, a former federal law enforcement officer who's working daily with the 20th Precinct. Our entire leadership team has been meeting with community leaders on a regular basis, and we deeply appreciate your partnership and goodwill. You may not know much about Project Renewal because until July 27th, we didn't have a presence in this neighborhood. We've been serving homeless New Yorkers for over 53 years. Today, we house over 2,000 people every night, half in 7 shelters and half in permanent supported housing we've built or rehabbed over the past decades. We deliver healthcare to over 13,000 individual patients annually through licensed clinics in our shelters and in mobile medical vans. We've built successful employment programs that have helped thousands of clients gain living wages to earn their way out of homelessness. One of these is City Beat Kitchens, which makes and delivers over 3 million meals a year to homeless shelters throughout the city. And before the pandemic, did bar mitzvahs and weddings also. I know you're all concerned about what we're doing at the Lucerne. We've heard your questions and created a special page on our website with more detailed information. The address is projectrenewal.org/Lucerne, and the link should be in the chat. But to give you a snapshot, here's what happened just today in the hotel on the 8 to 4 shift. We had 25 staff on site in addition to security. We delivered 774 meals to clients in their rooms, including dinner. We've done 721 individual health checks so far today, and there'll be more this evening. Our on-site nurse had 6 scheduled appointments and 9 walk-ins. There were 31 psychiatric and medical appointments. Our vocational counselor had 15 individual sessions and 1 group of 11 clients. Case managers held 26 individual meetings. We're doing 2 joint patrols with Help USA from the Belle Claire. A peer engagement specialist made neighborhood rounds every 2 hours. We distributed about 200 masks today. And actually, we've gone through 10,000 in the past 4 weeks. 19 clients went to work today out of 35 who are employed in total. There was 1 incident involving the police today. Some of you may have seen it. A client became very agitated and distressed and became aggressive. We called 911, they responded. The client was removed, taken to a hospital, and will be transferred to another shelter. Nobody was hurt. And there were no other consequences. I also want to celebrate that today we moved 1 client out of shelter and into his own apartment. And some of you have donated household goods to help that client settle in. I know you wonder how we got to the Lucerne. Let me take you back 6 months to the middle of March when New York went on lockdown. Cases were tripling daily. ICUs were jammed. And most of us were huddled in our apartments, scared to go outside. My greatest fear was that the virus would decimate our clients who live in dormitories with beds 3 feet apart, often 20 or more in a large room. I was terrified the virus would spread to our staff who take the subway every day and bring the virus back home to their families, their neighbors, and to every part of the city. I am unbelievably relieved to report that we have had just 81 cases of COVID-19 among the 2,500 clients we've housed in the last 6 months. 2, sadly, have died, only 1 in shelter, and that was someone who was on hospice before they got infected with the virus. Among our 900 staff, we've had just 31 cases, and thank God, all have recovered and are back at work. Our remarkable staff have showed up 3 shifts each day without fail, during the worst of the early days, during the protests and the curfew when the subway shut down at night. They are essential workers. So give them a smile and a thank you when you see them. Today, we have about 700 people in 4 hotels. Normally, it takes about 2 years or more to create a shelter. We had about 2 weeks notice for each hotel we opened, and we did it again and again and again and again and again, 5 times in about 3 months. Of course, it hasn't been perfect because this was a public health emergency. The Lucerne has calmed down enormously in the 4 weeks since we opened, in part because we've made changes based on your feedback. For instance, the precinct now has a patrol car stationed at the hotel most evenings. We've transferred 18 clients back to congregate shelter for repeated failure to respect our good neighbor policy. Our greatest challenge right now is finding a large enough program and outdoor space that is safe for them and for all of us. We're working on that, and we hope to have it organized in 1 more week. Thank you for the donated gifts of individually packaged snacks, books, single ride Metro cards, and games so many of you have left at the hotel. I can't tell you how much these gifts and your good wishes motivate the men to participate in our voluntary programs and activities. This hasn't been easy for any of us. We're all worried about a second wave of COVID in the fall. We're planning right now for a return to shelters, adding plastic dividers to create more spacing, improving air filtration and circulation systems, because we know we won't be in these hotels much longer. Charlie, Kadon, and I will be here to answer questions after the presentations are done. Thank you all for being patient and understanding. We are here to work with you for as long as we are a part of this community. Thanks.
Thank you very much. We're going to turn immediately to Help USA. And I'm not sure who will be speaking on behalf of Help USA, so help me out there. Is that
Mark, it's Daniel. Yeah,
Daniel
I'll be
Farrell?
speaking. Yeah.
Very good.
Hi, everybody. My name is Daniel Farrell. I'm a senior vice president here at Help USA. On the panel with me is Ronnie Silverman. She's our chief development officer. We have a number of people at Help on the call. Help USA, we've been operating since 1986. We provide shelter and programs and permanent housing in over 65 different program shelter and housing capacities, serving over 4,000 people daily. 90% of those folks are here in New York City. When we move, and in New York City alone, we run 12 shelters for single homeless men and women. When we moved to the Belle Claire on May 2nd, 3rd, and 4th, we made a couple of strategic decisions. And I'll get back to the our relationship to the mortality rate and all that Eric so eloquently and Erin so eloquently spoke about. We made a couple of really important strategic decisions based on the neighborhood. We opened up 2 shelters at the exact same time, one in Times Square in Manhattan, of course, and then at the Belle Claire. At the Belle Claire, we're represented by clients from 5 different shelters. We have about 260 to 270 clients there at any given night. About 35% of our clients are working full time. About 35% of our clients are also women. They're not all men at the Belle Claire. Most of our clients at the Belle Claire do not have major mental health issues, and many of our clients at the Belle Claire are high functioning and they don't have major substance abuse problems. Those clients from shelters who we serve, that population, were generally transferred to the hotel in the Times Square, which is a non-residential neighborhood. We made that strategic decision because we recognized very clearly that the Upper West Side was a much more residentially and dense neighborhood. And so we wanted to act as good neighbors. Right from the get-go, we made sure that we had robust staffing. We have many security staff, many case managers. Now we have 2 social workers, we have a nurse. At any given time, on a daily basis, we're doing about 250 daily wellness checks per day. Our nurse is going around to every single room, checking as many clients as possible to make sure that they're not presumptively positive, all of that. So I have to say that it's going actually very well in that regard. Now, let me double back to the testing numbers. When we moved into the Belle Claire, the city was ramping up testing. And at all of our shelters, we had an 8% positive rate. This was in June/July. And at the Belle Claire, we had a 6% positive rate. And don't worry, for every client that was positive or even presumptively positive, they were quarantined immediately. Now, I'm happy to report that in the last round of testing in the last 2 weeks, our positive rate among all of our shelters in New York City is 100% zero. We have 0 positive cases. Astounding. I actually thought that was a mistake, but that's consistent with what Erin has been talking about, that the numbers have been dropping through the floor citywide. And that's something that without our ability, the system's ability to move clients out of congregate settings into hotels, we would not be there right now. More clients would have died. Probably more staff would have died as well. The Coalition for the Homeless put out a report at the end of June, estimating that during the height of the pandemic, from March until the end of May, Memorial Day weekend, that about 200 per 100,000 New Yorkers estimated to have passed away from COVID. That's all New Yorkers. For sheltered homeless New Yorkers, it was about 292. At HELP, it was about 250. We ran our own analysis. So we were right in the middle from being about halfway between all New Yorkers and all sheltered New Yorkers. For all homeless New Yorkers, that number rose to about 320 citywide. So we feel like we've done as good a job as we can do in protecting our clients and staff. And I can't, it's hard to overstate how difficult our work was. And I know for many of you on the Zoom call as well, who work with people in any capacity, how difficult these decisions were and still are. March, April, and May, as we all know, was a very, very difficult time. But without our ability to empty out our shelters, we would not be here right now. Now, the other critical decision that we made, kind of fast forwarding, is that we did not close any of our shelters. We made that critical decision so that if a client acts out inappropriately, either external to the hotel or internal inside the hotel, we almost immediately that same day moved them back to their shelter of origin. That shelter of origin is either in the Bronx, in Brooklyn, on Wards Island, or in Washington Heights in Manhattan. So we really have a low tolerance, a low threshold for clients who are just behaving inappropriately or having some challenges or difficulty. And we're not moving them back just out of keep them out of the neighborhood, but sometimes when they go back to their shelter of origin, they're actually a little more comfortable. Those shelters have been emptied as well. They're operating at about half capacity. So being back to their shelter of origin is actually in some ways a point of comfort for them. So now let me talk a little bit about what we need. And I've spoken with many community residents who live across the street, down the street, and I really appreciate the outpouring of support. I read a couple of the articles recently in some of the local papers, and it really is great to hear kind of cutting through some of the noise. But what we need for our clients, look, we're in business to put our homeless shelters out of business. We all agree. Tony agrees, Eric agrees, Aaron agrees. All of us know that our job and our mission is to be out of the shelter business. We need business attire. Like I said, about 35% of our clients are working, but that's not enough. We need more jobs. We need access to more employment. Right now, we have clients working at places like Sephora, the New York Times. We have a couple of clients, 311 as a customer care service. We have a couple of clients who are construction workers, and we have a number of clients in the food delivery business, among other things. We have a number of clients who work in other nonprofits and shelters. And we need to expand our employment opportunities for our clients. And lastly, and most importantly, regarding the work that we do, is ending their time of homelessness, as Eric said so eloquently. In August alone, we were able to move 7 clients from the Belle Claire out of homelessness into their own housing. This is a tremendous thing. We have 5 more in the pipeline that we're hoping to move in the next 1 to 2 weeks. So that might be 12 clients who were homeless at the Belle Claire from the beginning of August through about the second week of September that are no longer homeless. They either are or will be in stable and secure housing. And that is something that we do our best to celebrate every time that we do that. Lastly, I want to say on a personal note, I started my career 30 years ago as a volunteer on the Upper West Side. I started at a synagogue, Anja Hesed, on 100th Street in West End. I started doing overnights with folks who are homeless, much to my parents' horror, which only made it better for me in some ways. And it really launched my career of public service. I'm an outer borough kid. The sense of public service and where I grew up on Staten Island was non-existent. I learned about public service by and large from the Upper West Side. I moved from that volunteer experience. I moved to God of Riverside in another volunteer experience. Then I was hired by God of Riverside. And then I moved on from there. I worked at 4 different places on the Upper West Side for about 8 or 9 years in my 20s. And it only launched my career and it kept me going in homeless services for the ensuing 15 years thereafter. So I'm really appealing to all the great comments and all of the well-wishing and all what people want to do, like the list that I just provided. There are things that we need from the community, again, in order to end our clients' time of homelessness. Thank you, everybody.
Thank you, Daniel. I'm going to interrupt for 2 things. One is that there's a lot of comments in the chat about concerns about safety. I have those questions. We will get to them. But we also have Monica Berry, the principal of PS 87, with us, who has another commitment coming right up. So I'm going to interrupt our flow to call on Monica as a community stakeholder. Just a couple of minutes, please, Principal, but we're grateful that you're here and thank you. Please take it away.
Thank you for having me here tonight. So I actually have had the opportunity to meet with both Project Renewal and with Help USA separately, along with the principal of PS9, to talk about what we can do just to ensure that we are all feeling safe in this situation. And so we discussed what we would do in terms of the patrolling around the area, because I know that there has been concerns about people gathering in our play yard and things of that nature. So we talked about that. When school is in session, and we also told them that we will let them know our hours that we would be in school and the times when children will be outside, so that they can also coordinate their patrols at that time as well. So we're going to keep working together with them. We have numbers to call if there's anything that is going on, so we can reach out right away to talk to security to help us. So we definitely have been working with both organizations to make sure that we are doing all that we can while school is in session to make sure that kids are safe. The one area that we haven't been able, or the one office we haven't been able to get in contact with yet, is with the 20th precinct. And I guess our question for them would be, what role will they be playing in patrolling as well? I do know that, there is so much that the security can do from the agencies, but then there's also just the idea of if there are police patrols to help if there's anything else that's going on, particularly when we are entering our buildings in the morning, and when we're dismissing in the afternoon, and if there's any time during the day if we're using our play yard. So we have been working with, like I said, both agencies, with both of the organizations. We'd also like to have a conversation with the 20th precinct to talk about added protection that could come to our school to help us in maintaining the safety and security of the members of our community.
Thank you very much, Principal Berry, and good luck with the reopening. That's obviously a Herculean task times 3, I guess, because it's in person and remote and then blended. So thank you for that. And I'm going to go turn now back to our service providers, and the third one is CUCS. And is that Mr. Hannigan, or who is going to present on your behalf?
Yeah, hi, it's Tony Hannigan. Good evening, and thanks to CB7 and Manhattan Borough President Gail Brewer for pulling us together tonight. I'm Tony Hannigan, the founder and CEO of CUCS. I'm joined by my colleagues, Julie Lorenzo, Chief Program Officer, and Gregory Mendelson, who's the Program Director at the Bell Nord Hotel. For those of you who are not acquainted with CUCS, I'll give you a little bit of background. We were originally a project of Columbia University, and then we spun off as a completely independent organization in 1993. I didn't know that about Daniel, about starting his career on the Upper West Side. I did too, being part of Columbia University, actually doing organizing in the single room occupancy hotels at the time. And in some ways, this is reminiscent of that, right? Because we're talking about people who are, in many cases, down now and looking to make a better life for themselves. And we're trying to help them do that. Today, CUCS has 30 programs across the city that emphasize housing and restorative health and mental health services for homeless and formerly homeless individuals and families. What those look like is street outreach, the full continuum, street outreach, shelters, safe havens. We do a lot of supportive housing for individuals and families. And we also have partly because of our genesis at the university, have a very substantial national training program. We train 15,000 staff per year in best practice around homeless people. And this includes the NYPD. We do the training for the NYPD on crisis intervention when they do respond to EDP calls. All in, CUCS serves about 50,000 people annually. On May 21st, we relocated our 101-bed shelter in the Bronx to the Bell Nord Hotel. For us, this was a lifesaver. It was prior to testing, but we figured we had at least 20 COVID cases at that point. And in a congregate setting, it's impossible to manage that, and it's a threat for everybody in that shelter, and it's a threat for the residential neighborhood that we resided in. And so we were grateful and remain grateful to be able to be at the Bell Nord. And we were actually very proud to have been able to, as a staff, to regroup so quickly and recreate our program in a totally different setting, which was just, it was uprooting for everybody involved, the staff, but also for the residents. We've acted upon our good neighbor policy, and that has been returned to us. Both Eric and Daniel have mentioned the being supported by the community. We feel that very much. The support and the inclusion, the contact with us, the donations that we've received, keep them coming. Everybody really appreciates that. At this point, I would like to get into some more detail just about what our staffing looks like and what we're doing at the Belle Nord, and just some updates. And Gregory, if I could call upon you to give us a brief summary of that.
Sure. Thank you, Tony. Can you hear me? I came up.
Yes.
Okay.
Sure can. I'm looking at the clock at 7:15 and we haven't gotten to questions yet. So if we could move a little bit faster, that would be great.
Sure.
Thank you so
No
much.
problem. So I'm the program director at the Delta Manor at the Belle Nord. We relocated at the end of May. We have 101 men with us, and I'm a licensed clinical social worker, and we have social workers on every shift on our staff. We also have medical and psychiatric services provided through our Janian affiliate, and we work very closely with them. When we moved into the Belle Nord, I think it was, like Tony said, very disruptive to everybody. And we've worked very hard on trying to address the community concerns. Some of the things that we've been doing is that we created a smoking space for the clients, because we know inside the hotel, and we were lucky enough to have that space, we know that people congregating out on the street is something that is unpleasant. It blocks traffic. It's intimidating to people. So we also instituted perimeter patrols with our security, and they wear yellow vests. They go around a couple times a day just to make sure as well that nobody is loitering around in front of our building. We also reached out and started working with NYPD. Deputy Inspector Yaguchi is on the call. I've spoken with him. He has my cell phone number, and we've been working with trying to create a great partnership with them. And I'd like to thank him and all the officers for the help that we've gotten from them. And I've also put out my number, and people have reached out to me. I've spoken to many of you on the phone about general things about client concerns, and we're trying very hard to address any concerns that people have and being very responsive to that. And I would echo what Eric and Daniel said about moving people out. We actually just moved somebody out last week. We had some interruption because of the move, but we did move out somebody last week. And we actually have about 6 more move outs scheduled right now. And I say that because my experience in the Bronx and working with the community there is that when we start to move our clients out into permanency, we create the type of situation where they're invested in the shelter, they're invested in what we're doing, and they're invested in the community they're in because they want to see their lives move on. And I think that kind of tangible benefit and that kind of tangible result is one of the things that I point to as being the progress we've made since we moved in sort of getting ourselves situated, responding to the community concerns, responding to our clients' concerns, and being the type of good neighbor that we have been in the Bronx for many years. And I think that we're getting towards being on the Upper West Side. And like I said, I'm at the site most days, and I've spoken to many of you. So if you have concerns, you can certainly address them to me here or at the site.
Thank you so much. This is a terrific presentation, so we have a better feel of what our service providers are about. I'm going to try to keep us moving here. So I'm going to start turning to our community partners. The first one would be Deputy Inspector Naoki Yaguchi, who is the commanding officer of the 24th precinct, and as I understand it, will be speaking on behalf of both the 2-0 and the 2-4. Good evening, Deputy Inspector. Are you with us, and can you speak?
Yep, good evening. I don't know if you guys can hear me.
Can, sure do. Please go ahead. Thank you for being with us.
Yep. Captain Zuber unfortunately couldn't be with us tonight because I think he had surgery on his hand, an injury he suffered about a month ago or so. So I'm here on behalf of the 2-0 and the 2-4. I just want to say that with the recent attention on all these homeless shelters and hotels, I hope we have tried to put a lot of cops out there on Broadway to put a little bit more presence to counter some of the unpleasant things that the residents of the Upper West Side has seen. I hope that everyone has seen that. Chief Bocciardo has kind of made it a priority, him and Chief O'Reilly, put some extra cops out there just so people feel a little bit safer. I know Miss Berry, I think, from the school spoke. She talked about having some extra cops. I mean, obviously we have many schools located throughout the 2.0 and the 2.4, but that's definitely something that we can do during dismissal, during the start of school. If the schools do come back, that we can try to put more cops out there. That's something that we already do when we have schools that have violence issues or whatever it is. But in this instance, you know, to protect our kids, to make the kids feel better, to make the parents feel better, that's something that we can do. But that's in the last 2-3 weeks, we've definitely tried to step up our patrols. And I think hopefully you've noticed not just cops out on patrol, but also cops out on foot to make their presence a little bit more seen and more visible.
Thank you so much, Commanding Officer, Deputy Inspector Yaguchi. We'll have some questions for you later, so I hope you can stick around. There are a lot of questions about reporting crimes and what does and doesn't work in terms of providing that information to the NYPD. So when we get to our Q&A, I'm hopeful that you'll be with us to answer those. So I will now turn to elected officials. We have a couple more than we anticipated. Before I do that, I want to, we'll hear from Gail Brewer, Helen Rosenthal, Linda Rosenthal, if Robert Jackson, Senator Jackson's with us, and then Brad Hoylman, in that order. But I wanted to recognize those elected officials who sent representatives but were not able to join us. Comptroller Scott Stringer was able to send Jessica Silver and Mike Stinson of his team. Congressman Jerry Nadler sent Robert Gottheim. Congressman Mark Levine, I'm sorry, Councilmember Mark Levine, I just gave him a promotion, sent Eric Cuello. Senator Brian Benjamin sent Shanna Harmongoff. Senator Jose Serrano Jr. sent Suad Hassan. I guess Jacob Priley is with Senator Hoylman. Hope Kay is with Senator Jackson, and Liam Galligan for Assemblymember Danny O'Donnell. So we thank everybody for the attention of our elected officials paying to all of this. I don't mean to be rude or disrespectful, but I'm going to beg my elected officials to please keep it to 2 to 3 minutes. Calling on Gail Brewer first, and with thanks for all of your help that you gave us with this meeting.
Thank you very much, Mark. And I want to thank the 3 providers. I have to say, knowing Manhattan well, people may not know this, but they're 3 of the best. We could have had others whom I will not mention, but for whom I do not have respect. I also want to thank the 79th Street Block Association and everybody who's been working on this issue. I'm going to be less than a minute. We wrote a letter to Commissioner Banks. It's up on social media. It's going to be on our website, and it certainly has been in our newsletters. And I am upset because if in fact the city moves people into hotels without telling the community, then we can't plan. And I know you understand, you don't want to be told no, not to go into the hotel, but you got to plan. And right now we're in a situation when there's not a lot for the individuals to do during the day. So we have been trying to work on that at the Lucerne, at the Belle Claire, the Belle Nord, and we are working with some local providers to try to change that. But that is a concern. If you plan in advance, then we could have dealt with that. Second, I know that security is the issue. Again, planning would have helped. How can we work with the precincts who are trying so very hard? I know that the security staff is going around to the different hotels, particularly at the Lucerne, and they've been very responsive. And Charlie's discussion with the restaurants has been phenomenal because I've been to all the restaurants. They have his number and they appreciate it. But if we could have had some discussion in advance, how we would understand, because I'm not sure I do. What does NYP do? What does the outreach teams do? How do they work together? That would have been helpful. Just in terms of outreach, I have been begging DHS for more support so that people would know who's from which hotel and who is the individual working with Goddard and the outreach. I haven't been successful yet, but I think there might be one glimmer of hope to get more support. And I just want to say that we do have a copy of the contract. If anybody wants it, I'm going to put my information into the chat. I'll be glad to send it to you. And just finally, I think that we don't know when the end date is. We know that this is not a permanent situation. I do wish that we could figure out, because I've got Midtown too. I got the entire borough and I know all the problems. I was in Midtown 2.5 hours today walking around, same issues, same problem. And I wish that we could figure out as a society that if people have the kinds of challenges, and I understand the need for COVID, be more secure in terms of not being in congregate shelters. I've been working in this area for a very long time. I understand exactly what you're doing. But we do need to think of our stores, our small businesses, and figuring out we got a garbage problem. There's so much in one community, it's hard for the folks to deal with it. So we do need to figure out how can we be more supportive on the issues that were listed, but also how do we figure out how we do have higher quality drug treatment or whatever is needed on a daily basis. So thank you, Mark. I do want to say to DHS, we need permanent housing. And I have a building at 1763 Amsterdam Avenue, which DS wants to make transitional. I want to make it permanent because the biggest problem we have is the lack of supportive housing. Thank you very much.
Thank you, Borough President. I wanted to acknowledge that the public advocate, Jumani Williams, has a representative here, but the name went by so fast in the chat, I didn't catch it, but it's in the chat. I thank the public advocate for being with us and turn immediately to Council Member Helen Rosenthal. Helen, can you unmute?
Yep, I think so.
Thank you for being with us.
Yeah, thanks for having me, Mark. And thanks to all of Community Board 7 for hosting this important information session. And thank you to the hundreds and hundreds of residents who are participating tonight. I'm here, of course, to listen to my constituents, but I'm also here because we have to find a path forward together as a community. Now, these shelters are not permanent, but they are absolutely impacting us. That's without a question. We are also experiencing the impacts of a growing street homeless population. And as I look through the comments in the chat, I think many of those comments have to do with the street homeless. And unfortunately, Goddard Riverside Outreach is not on this town hall tonight, but we should be,
actually.
Oh, great. I hope they can talk about this. You know, in agreement with Gail, we need many more resources on the street to make sure that we are helping our street homeless actually agree to come in to shelter. So how can we make sure that everyone feels safe on our streets? And how can we make sure that the people living in the shelters are getting the services they need so they can live here safely and then move on forward? And I felt Eric started to address that in talking about the types of meetings that that his staff has been working on today. To me, these are the two overreaching questions. Listen, I've so appreciated the very many conversations I've had with you, but I was struck in particular by the email that Mark Greenberg sent out today, and I see him here as well. Mark directs the Interfaith Assembly on Homeless and Housing. I agree with him that the Upper West Side can play a very constructive role as the city tries to address the COVID-19 crisis and our crisis of homelessness. For a limited time, several hundred shelter residents will be our neighbors. As Mark asks, how can we find a way to live responsibly and respectfully together? Thank you, Mark.
Thank you, Council Member. I'm now going to call on Assembly Member Linda Rosenthal, and followed by Senator Robert Jackson and Brad Hoylman.
Hi, everyone. Hi, Mark, and hi, community board members and providers and everyone else on this call. I've lived on the Upper West Side my entire life. My family fled Nazi Germany to come here, and they took root here on the Upper West Side at a time before our community had a great renaissance. They worked to build a community we could all be proud of. It took many years, and here we all are. But the COVID-19 pandemic has changed life for all of us, sheltered or not, in a very short period of time. And the changes have been significant. for many people's lives, incomes, housing situations, and the future feels and is uncertain. And I've heard that sentiment from so many of you over the last several months, those who've called to discuss homelessness, those who've been laid off, and my office has helped thousands of people get their unemployment from the State Department of Labor. And people struggling to pay rent and feed their families. So these times are tough for everyone, including the homeless men and women who were moved into our neighborhood seemingly overnight in an effort to keep them safe from the disease. I do agree that we should have been notified so we could all work together before people were placed here. I always say this, communities need to be in on what is going on. The city and the state at times cannot just place people in a community without getting communities to be part of making it work. And no one learns their lesson, and this keeps happening. Maybe after this it won't, but there are hundreds of new people in a 7-block radius. And we also see a lot of people, including some in front of my district office, who are on the street. Our homelessness problem was record-breaking before this. COVID-19 laid bare all the flaws in our system. Our homelessness problem is not an accident. It's the result of policies that have allowed people like Sandome and Michael Edelstein to warehouse units, kick out tenants, break the laws, and still be rewarded with lucrative contracts from the city. We've given out handouts to wealthy developers and not created enough permanent affordable housing, and that is what we are lacking. That is how we get here today. But I must say, as the chair of the Assembly Committee on Alcoholism and Drug Abuse, there needs to be a lot more treatment for mental health and substance use disorder. If I had a magic wand, I would ensure, and I hope that the city can come up with funding, even as they cut valuable programs, to engage some of the people who live here who are very troubled and have a substance use disorder. It is a disease. And let me be absolutely clear, all of science, no matter what side of science you're on, agrees that substance use disorder is a disease. It is no one's fault. It is no one's fault. But we need more resources dedicated to outreach and support, more counseling, more support so people can get better. People can move into their own housing. The city should not have placed sex offenders that it knew were not allowed in the neighborhood. That is not right. That is against the law, and laws are passed to be followed. So that was terrible and inflamed everyone, and rightfully so. You can't have sex offenders who are restricted for where they live in the community. But in the meantime, these people who were placed in Lucerne are here. They will be here. They need help. We can't just say move them to another neighborhood, because they are on our Upper West Side, just they are the way they are in Hell's Kitchen and Lower Manhattan. This is a problem that the whole city is dealing with. My hope is that it'll be soon that there is a way for people to live in congregate shelters with no chance of getting a disease. But right now, people in active addiction need support to stop using. People in recovery need support to maintain sobriety, and they need more access to counseling and drugs that can help them along the way. They're medication-assisted treatment drugs that will help people, but people also have to be ready. This is a very fraught situation. But it's our West Side, and it's up to us to make sure we all live together. Nothing is permanent, but we all need to work together and to make the West Side what it always has been.
Thank you.
Thank you very much.
Thank you so much for that. I'm going to turn now to Senator Robert Jackson. Senator Jackson, are you with us, and can you speak? All right, we're going to look for Senator Jackson while I call on Brad Hoylman. Senator Hoylman.
Yes, thanks, Mark. I'll be very brief. Thanks to the providers, DHS. Thank you, Gail, for putting this together and my colleagues. Just to say that the lack of planning, the lack of communication is unacceptable. Even in the middle of a pandemic, even when we're trying to, do the right thing, you could expect this outrage from community members, given the fact that they didn't know what was happening, given the fact that elected officials didn't know what was happening. So we have to learn from that. But in this situation, I'm going to get out of the way because there's a lot of very constructive comments that I know the community is willing to share. But I do have a question about what the time horizon is going to look like. What your epidemiologist or the Department of Health says is the figure for when it's safe for these men and women to return to congregate housing. I think, we have the right to know what you expect in the future in terms of the infection rate, which now, as we all know, is below 1%. When is it going to be safe, or are we looking at weeks and months, even though we're keeping the infection rate so low? So, but thank you to all the providers for doing this work. I'm greatly appreciative.
Thank you. Thank you so much, Senator. I don't see Senator Jackson with us. I do see Senator Serrano with us. I wasn't a scheduled guest, but Senator Serrano, if you can join us for just 2 minutes, please, and tell us a quick update.
Thank you very much. Appreciate the meeting, the purpose of this meeting, the necessity of this meeting, and it's really important that we hear from the community, that we hear from all the stakeholders. As I said in the previous meeting that we had on this issue, it's very difficult when the rhetoric becomes so harmful to a point where people retreat to sides and they don't really discuss in ways that are very helpful and move us forward. I'm very grateful that this dialogue is happening now, but as my colleague Senator Hoylman said, we needed a lot more of it on the front end. Each and every constituent who's reached out to the office, we have a responsibility to hear their concerns and to follow up on their concerns. But again, Mark, I don't want to take up time. I know we need to get to questions, but I appreciate you giving me the opportunity to say hello.
Thank you, Senator. I'm going to now, unless Robert Jackson is with us and I don't see him. So apologies to Senator Jackson. We get to you later if we possibly can. I'm going to keep going with our community partners, and I'm going to beg everybody to please, when we say 2 minutes, we really mean 2 minutes, please. I'm going to call on Doug Kleiman, my vice chair, to let us know when we're about 1.5 minutes in. So from here on in, we go with parent leader Adam Herbst from the Manhattan Day School. Please, Adam, unmute yourself and join us.
Hi there. Thanks, Mark. I'll be about 1 minute. My name is Adam Herbst. I'm a resident of the Upper West Side for the last 20 years. And tonight I'll be speaking on behalf of Manhattan Day School, school in the community for more than 75 years with more than 500 students from ages 2 up to 14. The school is located on 75th Street between West End and Riverside Drive. I would like to thank the entire community board for inviting me to speak this evening and for facilitating this working group of schools, and also express my most sincere appreciation to the providers and to the police in the 20th and 24th precincts for everything they do to keep us all safe. They've offered to increase the patrols near the school and have been accessible to speaking with us on more than one occasion. I have been a senior executive at a local children's hospital and previously worked for a nonprofit supportive housing provider based in Harlem. And I've also been an auxiliary police officer for the last 7 years. My wife is a pediatric infectious disease doctor and an epidemiologist. So we fully understand the city's plan to move these individuals to stop the spread of COVID, and agree that it was necessary in the middle of a pandemic to save the lives of people who have nowhere else to go. But in the interest of full disclosure, the percentage of people with COVID in the city is currently under 1% and has been for over 2 months now. And we really would like to understand what metrics will determine when this emergency will be considered over. First, as members of the community, we do intend to be good neighbors. I and the school supports helping the homeless, but neither we or any of the other parents or school groups were given notice and input about the moves that were being made here, particularly the unacceptable number of registered sex offenders moved so close to playgrounds and schools. There was zero transparency, despite what the deputy commissioner said earlier, and many of my neighbors have only shared their loss of safety with respect to this. In 1 week, our school will be opening, and after much preparation, most of the children will be returning to the school. The first and most important question that parents have right now is how students can go back to school safely in light of the ongoing pandemic. The latest American Academy of Pediatrics advice says that children learn best when they are in school, and normally kids will get bused to school through the Board of Education, but obviously due to the virus, that won't be happening this year. The vast majority of our kids will be coming by either foot or public transportation, then foot, and our parents are worried about the safety of themselves and their kids. Many parents have experienced homelessness before in the city, but this increased homeless situation that we're dealing with now has caused major alarm, a loss of safety and security, and many people are looking to leave the neighborhood, and some already have due to the increased harassment, the lack of hygiene, including people screaming, defecating, masturbating, coughing without masks in the middle of the street, open drug use, and in other cases, just blatant disregard for the law. The Upper West Side has always been a vibrant, family-oriented community, and in normal years, we often see people moving into the community and contributing to the community. Yet this year, obviously, we have lost many people due to the virus when they have looked for open space and less crowding. Now, unfortunately, with the appearance of less safety and uncertainty, more families are feeling less safe and are feeling like they're driven out. We understand that these people were not relocated to our community. They did not necessarily ask to be here, but while they are here, we need reassurances for the safety of our children and the parents while they walk to and from school. It would be unacceptable to move any more registered sex offenders or dangerous individuals so close to a school. Placing them there illegally to begin with was shocking, but we have been told they have all been moved out, and we hope this is true. We'll be running many programs for our young children outdoors this coming year, and we hope to assure that our kids will be safe as they have been in prior years.
For your plus 3 minutes, please wrap up. Thank you.
Finally, I just would like to say that we don't believe homelessness is a crime. But we do want to be part of the problem. We only support compassion for homeless individuals. We propose a work group between the city and the DHS and the service providers, the police, and members of the community. And I ask for serious consideration of this idea, so helping with communication and transparency. Thank you very much.
Thank you so much. I'm going to turn immediately to Carrie Goldwyn, who is with the Goddard Riverside Homeless Outreach Group. Carrie, can you unmute?
Yes, I can. Hi, everyone.
Thanks for being with us.
Happy to be here. My name is Carrie Goldwyn. I'm the program director with Uptown Goddard's Homeless Outreach Team. And I'm joined tonight with our executive director, Rod Jones, and our deputy executive director, Roberta Solomon. So I'm personally not going to give as eloquent a history of the agency, but I will just share a little bit about what our outreach team does. So our teams cover the Upper West Side. It's 24/7 coverage. We work with folks that are street homeless, that are staying on the street, with the ultimate goal of getting them into permanent housing. Along the way, we seek to place folks into transitional housing and provide a range of services, including connecting folks with benefits, medical care, psychiatric services, substance abuse treatment through other providers, and ongoing case management. Our teams are out there daily responding to not only 311s, but responding to hotspot locations and community concerns, as well as just canvassing the entire catchment area, engaging new folks and offering services. Was that too brief?
No, that's terrific. Thank you so much. I was not accustomed to somebody taking me seriously about the time. Thank you. I'm going to turn immediately to Lorena Matas. I hope I'm pronouncing that correctly. She is with the Upper West Siders for Safer Streets. Lorena, please join us.
Hi, thank you, Mark. Hello, my name is Lorena Matus. I'm a Hispanic citizen, and I'm a concerned parent and member of the Upper West Siders for Safer Streets. Upper West Siders for Safer Streets is a nonpartisan Facebook group that was formed by residents and local business owners out of collective concern for safety in our neighborhood. The Facebook group has provided a forum for information sharing and collaboration on solutions to address our concerns. After only a few short weeks, our group is rapidly approaching 12,000 members. So thank you for opening this, letting us speak tonight. Our safety concerns are not unfounded. In the span of a few months, our community has fallen prey to a number of incidents that we have not experienced in the Upper West Side in recent memory, such as unprovoked attacks and vandalism to residents' cars and local businesses. Just today, a man was seen running shirtless out of the Lucerne and down 79th Street while screaming as police entered the hotel. In addition, DHS placed 19 level 2 and level 3 sex offenders into temporary shelters without community notice or transparency. Many of these men are violent sex offenders and most committed crimes against children. Level 3 offenders and offenders on parole or probation are generally prohibited from living in 1,000 feet of a school. However, these men were placed on the Belclair in close proximity PS to a PS 87. It wasn't until the community raised awareness of this issue that something was done about it. As of today, NYS Sex Offender Registry reports 2 level 2 and 2 level 3 offenders living at the Hotel Belclair. The character of our neighborhood has changed a lot for the better. There have been countless incidents observed and reported of public urination, severe public intoxication, public hard drug use, and an increase in drug deals taking place on our streets, as well as a variety of forms of harassment, including catcalling and aggressive panhandling. In addition to the hotel shelter, residents have not been consistently wearing masks or social distancing in keeping New York state guidelines for COVID prevention. The city's recent actions have created a climate of fear and danger on the Upper West Side. These unsafe conditions have heightened fears of residents, especially the elderly, their caregivers, and women in the community. In addition, these actions have heightened fear of local business owners whose livelihoods are at stake. These conditions are particularly detrimental to our local businesses who are struggling to survive during the pandemic environment we're living. As we all know, this will continue to have an impact on our community for quite some time. Our elected officials have failed us, their constituents, through a complete and utter lack of transparency, accountability, and responsive actions for our concerns. You have an obligation to provide an environment of safety to your community, and you have failed to do so. The current situation affects everyone in our neighborhood, including the most vulnerable population, the homeless people, who have been failed by the city by being left out on the streets or placed in hotels with adequate social services and facilities to address their varied and complex needs. I'd like to ask our elected officials how our children are expected to go back to school in a few days when the streets they need to traverse to get to and from school present such unsafe conditions. What is the city going to do to restore safety in our neighborhood? What concrete steps will the city take, and when will they be put in place and communicated to the residents in our community?
Please wrap up.
I'm almost done, a few more words. And how will the city commit to adequately and effectively help the homeless population? I am an American citizen. I love my adopted country. We are all residents of this beautiful community, and we won't stay quiet. Thank you for your time.
Thank you for your presentation. I'm going to turn immediately to the Open Hearts Initiative and Melissa Sanchez, to be followed by the West Side Community Organization and Megan Martin. Please go ahead. Melissa Sanchez.
Can everyone hear me?
There you go.
Okay. Thank you for giving us a moment to tell our community about the Upper West Side Open Hearts Initiative. We're grateful for the work of the experienced and dedicated service providers that, as an emergency public health measure, have temporarily relocated to neighborhood hotels. As tonight's representatives have explained, services provided in the hotels are identical to those that would be offered in an ordinary shelter environment or any other temporary location. The staff at these shelters, as well as some of the residents, are among the essential health and service workers that we all applauded every evening at 7 during the darkest days of the pandemic. We do not want to send them to someone else's neighborhood. We know that all neighborhoods have children. We know that all people deserve to feel safe. Evidence-based studies have established that shame and stigma impede recovery from addiction and mental health disorders. Accordingly, the Open Hearts Initiative has sought to organize both moral and material support for recovering shelter residents. We have mobilized direct donations of supplies to these organizations. We have held art supply drives. We have hosted sidewalk chalk events where families can write encouraging messages. Recognizing that 35% of Help USA residents and 15% of Project Renewal and CUCS residents are employed, we have planned Metro card drives to help them get to their jobs. To assist those seeking work, we are organizing resume workshops and an employment fair. We seek to raise awareness of facts about crime in our neighborhood. As we've heard from several tonight, NYPD statistics show that while complaints about quality of life infractions are up, year-to-date violent and property crimes are down by 10% compared to the same point in 2019 in our neighborhood. Many in our group are parents, and we want to protect our children from sexual assault and abuse through awareness and through education. Department of Justice records show that 93% of assailants are known and trusted to their victims. 7% of assailants are strangers. Removing registered sex offenders would bring a very welcome reduction of the risks of stranger assaults in our neighborhood. It would not be nearly enough to keep Upper West Side children safe. We want to keep Upper West Side children safe, and we want to do that by reducing the greater risk posed by those that they know. Open Hearts Initiative and it's a group that has grown out of it, Upper West Side Strong, are thereby compiling prevention resources and planning expert-led online workshops in hopes of empowering our community to be proactive about all risks, sources, and warning signs of abuse and assault. We want to keep the Upper West Side a place that is safe, harmonious, and hospitable to all.
Please wrap up.
On my last sentence, we have written an open letter to city and state officials on this matter, and you can learn more about our work and join our initiatives at www.uwsstrong.org. We're not asking for your money, but we would be grateful for your time and help. Thank you.
Thank you so much. Returning to West Side Community Organization and Megan Martin. Obviously, we're running longer than this meeting was ever intended to run. I'm going to do my best to move us along here. We will get to questions and answers. Please help us out with that. Megan Martin is the next to speak, and we'll get our stakeholders and then our questions.
Thank you, Chairman Diller and CB7. I'm the president of the newly formed nonpartisan and grassroots community group, the Westside Community Organization. In March, COVID changed our world in a way no one could have imagined. Every New Yorker has been deeply affected. As a medical doctor who also has a master's degree in public health, I am particularly aware of the risk that COVID presents to our homeless population. However, what has occurred on the Upper West Side is to replace one public health crisis with another. The Upper West Side is known as a welcome and diverse community. In a short period and without any transparency, a large at-risk homeless population was relocated to 3 local hotels ill-equipped to serve their needs. A significant number of the residents in at least one of these hotels are classified as mentally ill and chemically addicted, otherwise known as MICA, a particularly high-risk population and in need of greater support services. The mayor himself admitted when this policy was implemented that hotels are not the answer, and many homeless advocates have noted that in the case of MICA shelter clients, temporary hotel housing may create significant community problems as well as fail to provide appropriate services to this at-risk population. As a result of this failed policy, Upper West Side residents have witnessed in a very short period the growth of open and illicit drug use, needles on our playgrounds, aggressive panhandling, and public masturbation. In implementing this policy, the city did not evaluate the impact that these hotel shelters would have on this vulnerable population, consider the effect on existing residents or businesses, or seek input from the community. In doing so, the city has failed us all. These problems should not have been a surprise, as I understand these same effects happened when many of these same residents were housed at the Washington Jefferson Hotel on 51st Street as part of the city's COVID response efforts. The solution to the complaints of that neighborhood, Speaker Corey Johnson's district, was to move many of these same residents and problems 28 blocks north to the Lucerne Hotel, where history has repeated itself. This undercuts the argument that this was all COVID related. Also, this has deeply impacted our quality of life and devastated the rebirth of our small businesses who were so desperate to reopen just as the second hit occurred. We are asking our local officials to fix the failed homeless hotel policy that has put both the men and community at risk. These individuals should be moved back to housing which is appropriately equipped to deal with their specialized needs as quickly as possible. This is even more true given the diminishing risk of COVID as the city reopens. And the mayor himself committed to moving these residents back to appropriate housing immediately. The city instead moved more homeless residents into another commercial hotel in Brooklyn. While we recognize the pandemic has changed the world, it cannot be a veil for careless decisions by our elected leaders that are detrimental to our community. The city's approach on the Upper West Side cannot be the new normal. The West Side Community Organization urges our politicians to take action and insists that the city honor the mayor's commitment and set a clear date by which this failed hotel experiment will end. Every New Yorker deserves better. Thank you for your time.
Thank you so much. We're going to keep moving right along. I'm going to ask the remaining speakers to please keep it as short as they possibly can. Dale Brown of the West 79th Street Block Association, followed by Steve Anderson of the Theodore Roosevelt Park Neighborhood Association. Dale, you're up.
Thank you, Mark, and thank you for everyone who's participating. I'm Dale Brown, president of the West 79th Street Block Association, and I've lived on West 79th Street for 50 years. When it was announced that 283 homeless men with drug and alcohol abuse issues would be moving into the Hotel Lucerne, the neighborhood was in a state of shock. People were scared and angry, concerned for their safety and the safety of their families. And there were those that were welcoming, concerned for these men's welfare, and wanting to greet them with kindness. It has been a tradition that West Siders have always welcomed the less fortunate and the homeless. Everyone wanted to know why we didn't have advance notice, how come our elected officials were in the dark. There was no community input, no time to prepare, and major concerns about these men being so close to our schools. We're already dealing with the pandemic, people working from home, people have lost their jobs, seeing local merchants struggling to stay open to serve the community, and seeing many of our favorite stores close their doors forever. Now we had the addition of the homeless men in this shelter. The first 3 weeks were truly a nightmare. Men roaming our streets, gathering at the Medium at 79th Street and Broadway, 15 or more, none wearing masks, smoking, drinking, throwing garbage around, and blocking the crossway to the other side of Broadway. The Block Association has made constant and instant communication with Project Renewal management heads and their security chief. I personally have conversations with their senior VP and the COO every 2 to 3 days. Several of us have met with the chief of security and their VP of programs. Things seem to be getting better. Project Renewal has now had all their administrative and program staff at the Lucerne, formerly from the 2 shelters in the village. These people know the men and the men know them. Programs are being held at the Lucerne and at the 3rd Street location where the men are driven in vans. We are seeing less wandering men around the neighborhood. The Block Association requested more security guards patrolling 79th Street from Amsterdam to Broadway, 78th to 80th Street. Project Renewal now sends out more security guards. At a meeting with Captain Zuber of the 20th Precinct, we requested more police presence. As everyone knows, the police force is at a bare minimum. Due to budget cuts, their outreach program is no longer. They cannot hire any new officers. The captain has assigned 6 officers to go from 72nd Street to 86th Street on Broadway from 12 o'clock noon to 8:30 at night, patrolling this particular area. There is a patrol car that's parked in front of a Lucerne at 9:15 in the evening till 10:30 at night, observing the men returning to curfew.
Please wrap up.
Okay, I will, thank you. The guardian angels have been around our neighborhood. Elie Wiesel said, "Indifference can be seductive. It is much easier to look away from victims. These men are victims. This is a temporary situation for these men, and we would like to make it a win-win situation for all of us. We want our neighborhood to be safe and welcoming. Project Renewal is working hard to educate their clients, and they are working closely with our block association. Thank you for your time."
Thank you, Dale. We're going to go right to Steve Anderson. Steve, please.
Yes, thank you. I will be very brief. And we've created another crisis. And that crisis is that we simply don't have confidence in government. Government let us down. They went around the backs of our elected officials, and they didn't provide the type of engagement that would have given us an opportunity as a community to rise to the occasion from the start. Where do we go from here? I'll be very quick about this. I think there ought to be a website that has every day a report from the providers on all the information that they have shared with us now. Every day, update us and give the information. Not a Facebook page where there's a bit of debate, but a report from DHS and the providers each day that we can access. Secondly, please tell us what we can do as a community to be part of the solution. This is essential for us to move forward. We banged the pots and pans to recognize the essential workers. We did it because we knew that was important. We recognized the need for justice in our community. We have a great history of compassion here. Give us the tools to let us use in our capacity in this case now, and let's move forward. Thank you.
Thank you, Steve. I'm going to go to Melissa Bender, who is speaking for Rabbi Lauren Grabel Herman. I'm hoping that you can edit your statement on her behalf, because it's already 8 o'clock and we desperately need to get to Q&A.
All right, it's a 3-minute statement. I'll do my best. To the members of the Community Board 7 and the Upper West Side community, from Rabbi Lauren Grabel Herman, SAJ, Judaism that stands for all. I regret that I cannot join you this evening due to a longstanding commitment. I proudly have served as a rabbi of the Upper West Side for over 5 years, and in just 1 week, I will call the Upper West Side my home. The Jewish community has entered into a time of personal and spiritual reflection in advance of the Jewish high holidays. It is a time in which we consider the ways in which we have not lived up to our stated values or been the best version of ourselves. It is the time we aim to set ourselves on the right path. As the community meets to discuss the temporary use of shelters in the Upper West Side neighborhood, it seems to me an opportune moment for this kind of reflection. Have we been showing ourselves to be the people we profess and hope to be, a people who believe in opportunity, diversity, and inclusion? Have we participated in or tolerated speech or behaviors that dehumanize others or lay the blame for systemic societal problems on a few individuals? Have we followed the golden rule and done unto others and as we would have wanted done for us? Jewish tradition teaches that even the most poor in a community must give some bit of charity. We do so, we are taught, because we never know if we might be one of the people who one day need that same charity, and we want to promote a cycle of giving. Being homeless is not a crime, and it is not a personal failure. It is and has always been a result of a system of inequality in combination with a lack of access to needed services. In this pandemic, the richest Americans added to their wealth, while others lost their jobs, benefits, health insurance, and many did not even qualify for stimulus money based on their immigration status. If and when evictions begin to take place and unemployment continues, we will see more people in need of shelter. As things go from bad to worse, it is vital that we work with the shelter providers to support them in their needs to serve the population, including more outreach workers to support their mission. This time of reflection also offers us a time to listen and to learn. I would love to see, and am willing to take a leadership role in seeing our community talk about and think about how we got here as a city and a country. Many of the chronically homeless who sleep on our streets and are not living in any of the 3 locations suffer from mental illness. What are the mental health services that are available to the poor? There are those in shelter who use drugs. How is our city and state working to prevent drug use or provide adequate support for those who want to turn their lives around? And perhaps most of all, what does the amount of people without homes in New York City say about our social safety net? And what can we do about all of this? I hope and pray that we can ask questions of ourselves in this moment and to engage in the big picture, long-term conversation. If we believe that all people should live in dignity and have the chance to be safe, let's begin to think about the bigger issues and how we can do something to make our city more equitable and more hopeful for all who live here.
Thank you so much. Pastor Kay Carpin from the Church of Saints Paul and Andrew.
Thanks, Mark. I will try to be brief, very brief. Our church has been on the Upper West Side since the 1890s. I myself have only been here since the 1980s. We've tried to do what we can to create a positive situation here. We are actively engaged in work, both with homeless individuals and also with a number of other residents trying to prevent additional people from experiencing homelessness. We try to be a good neighbor to everybody on the West Side, both long-term residents who care so much about this neighborhood as we do ourselves, and also now figuring out how to be good neighbors to these temporary residents who have come here. I love the West Side. It's been a wonderful place for me and my family. I love the energy, I love the diversity. I love what I think and I've experienced as a spirit of compassion and a spirit of open-mindedness. And I hope that through all this, we can keep that in mind and keep that going. I guess my question, and the question of a lot of other clergy that I've been in touch with and a lot of other communities of faith, there are about 60 to 70 communities of faith in the West Side. We want to know what we can do to be constructive in this situation, what we can do to support the residents of these shelters, and also what we can do to get to a healthier conversation about safety for these new residents and safety for long time and ongoing residents of the West Side. We're very interested in that. And so I just offer whatever resources and help that we can offer to the situation, which is not ideal. Nothing about this pandemic is ideal. It all sucks. And we hope that we can move forward in a positive direction.
Thank you, Pastor Kay. Those questions are also in the Q&A that I'm trying to get to. I'm going to call on one co-op and condo board recommended to me by one of my colleagues. This is Yuri Pavad from the Central Savings Bank building. Yuri, 2 to 3 minutes, please, no more. Yuri, can you unmute?
Yes, okay. Well, thank you for inviting me. I represent the boards of condos and condominiums of the Upper West Side. And if I can just summarize 2 points. Number one, there is a stark difference between what officials presented to us today with reality and what actual our neighbors feel and see in the streets. And the second message I would like to say on behalf of other board members, that we see exodus of our neighbors from this neighborhood. And the recent development with moving these homeless people actually accelerated that movement. And I've been hearing that people are concerned about the schools and people with families moving out, and with them, local businesses losing their clients, and we're losing revenue from taxes, sales taxes, from property taxes, small businesses losing customers, and their employees become unemployed. And we can see more and more vacant real estate in our neighborhood. So the trend is not very rosy. And that's my message.
Thank you so much. The last person I'm calling on before the Q&A is Mark Greenberg from the Interfaith Alliance on Homelessness and Housing. Mark, can you help us with a quick statement?
Thank you very much, Mark, and thank you all for everything you've offered and contributed. And let me just say, we are such a great community on the Upper West Side. I'm so inspired by all of us. I know that if any community can figure this out, we can. I've been working on the issue of homelessness and affordable housing for about 35 years. I think some on this call have been doing it longer than I have. We have a tremendous amount of institutional memory and collective wisdom here. I also want to acknowledge the fear and concerns of some of the in this gathering field, but I must say, in my experience of working with over 500 homeless individuals, I have never once felt threatened. So I think fear, even unfounded or largely unfounded fear can be a very powerful thing, but I would suggest anyone who's afraid should get more engaged, and we will learn that the fear is largely without merit. As Linda Rosenthal mentioned, substance abuse is an illness, and I think many of the men who have visited us on the Upper West Side are struggling with this illness, and many of them very successfully. I would suggest that those in the group that are having very difficult times and are creating problems are a vast minority, and I'm glad to hear from Ms. Brown that the numbers of problems have disappeared or have been reduced. I just want to say one thing. I think that a big element that's really not being included is the fact that I think any fruitful conversation that we have about homelessness must really include representatives of homeless themselves. I mean, after all, the homeless programs, homeless system is to help them. They are at the center of this issue. They need to be part of the conversation. They need to be part of the solution. And I know in my work with homeless individuals directly, they want to help. I think that what we need to do is find ways of engaging them, give them an opportunity to be of service. I think, as my friend James Addison, who is formerly homeless and worked with the homeless, Mark, if there are no problems in the building, there will be no problems in the neighborhood. We need to speak to these folks and ask them what we can do to help them and how they can help us. Now, how can they help? I understand that we had some restrooms that were dismantled because there was vandalism. We could have had some of the guys from the Bel Claire and others being security people at these facilities. We could have people on the street, part of a neighborhood hospitality corps, providing services, helping people be directed to bathrooms, to provide security, possibly help with voter registration or with poll watching. There are things that they can do that we need to ask them to do. They need to feel engaged. You know, people that we have in these hotels, they're going through the most difficult time in their entire lives. This is not who they wanted to be. This is not who they grew up to be. They're going through hell. What they need is a community to support them. What they need is someone to listen to them, to ask them how they're doing, to say, what's going on? How can we help? I think Kay's offer of faith communities wanting to help is crucial. We all need to be there for them. And I think together we can figure it out. I just read a chat from Miss Cohen, who said, my husband and I have lived in the Bel Claire for years. We welcome our neighbors. Everyone has been attentive, wants to live harmoniously in the building. I think that is by and large the truth of the matter. And I think, again, together with all the collective wisdom, we can make this work. And I know we will. And I stand ready to help. Thank you, Mark, and thank you all.
Thank you so much. I'm going to turn us now to questions and answers that were submitted in advance, which we have compiled and tried to, you may not recognize your own words, but there were many common areas. I'm going to beg our team from this. Obviously, it's 8:15, and it's obviously later getting to this than I had ever hoped we would. But I thought it was important to hear from our community organizations who asked to speak. So we've done that. We're going to go to Q&A. With the permission of the DHS team, I'm going to go right into questions and answers, and we'll jump with that. I'm seeing Ms. Drinkwater nodding yes, so thank you for that. We're going to jump right into that. And so the first question, there were a lot of questions around the duration, the length, and so forth. And the questions that came out of that were, how long is temporary? How are will these hotels be used for permanent shelter after the temporary use is concluded? And then there were a lot of questions about fair share, that in effect, fair share is the suggestion that there are many more of these kinds of operations and facilities on the Upper West Side than there are in certain other communities. So can you address how temporary is temporary, and also speak to the distribution of the use of hotels around in various neighborhoods around the city? Thank you.
Can everyone hear me?
Yes, thank you.
Okay, great. Thank you. Okay, so on the timeline for going back into congregate shelters, what we know is moving into the commercial hotels has helped us in respect to the low infection rate that we are currently seeing. We are also continuing to test our clients who are in our single adult system. We are working just as closely as we did with the Department of Health and Mental Hygiene, State Department of Health, and CDC based on their guidance as we were when we left the shelters, as we will be to go back into the shelters. Our single adult system is a system that built up haphazardly over many, many years. Each shelter building is laid out in a different way. It requires a different analysis for each of the locations. We are currently using congregate shelters. We've been able to do so because we've been able to de-densify those locations by moving people to commercial hotels. We have to be able to have both the ability to social distance in the commercial hotels, the availability of testing, and making sure that our clients have access to those things so that way we can continue to keep the infection rate low. The move back to the commercial, the move back to the congregate capacity will rely on those things. We do not have a definitive timeline. I understand that the mayor's comments provided anxiety in a good way that this was coming to an end soon. There are a lot of unknowns beyond our control, and we're working together with the medical experts to continue to make sure that New York City's infection rate as a whole remains low, right? The way that our system interacts with New York as a whole is also important here. So I understand that everyone wants a definitive timeline. We are working with the experts to be able to understand what thresholds need to be met to be able to go back into the congregate locations. The city is slowly reopening. Our experts at the test and trace location are minding the numbers to make sure that if we're seeing increases in the infection rate, that we're able to determine how and why that is happening. We'll continue to provide masks and testing to our clients in the single adult system. Some of the other questions included fair share. I mentioned in my remarks the fact that the city has gone into approximately 60 hotels as part of our de-densifying effort. 4 of those were located in Community Board 7. For numbers in terms of individuals placed in community districts, the Upper West Side does have other locations that are used to house or shelter homeless New Yorkers. It falls sort of like in the mix of where the city is. So those are the numbers I can provide you today.
Thank you. I'm going to shift to sex offenders because that's obviously one of the more incendiary questions that is on everybody's mind. It's obviously filling up the chat and so forth. And I guess the questions are stem from what is permitted. There was it would be great to have clarity on whether there are any registered sex offenders left in these hotels, and if you could address the concerns of folks, especially parents of children in a residential community that is being shared with multiple sex offenders and of different levels.
Sure, I will answer the question. We provided this update and response both on last Wednesday's stakeholder call and then in writing to the borough president with the hopes that it was getting disseminated into the community. The City of New York places all of our clients in appropriate locations in accordance with state law. And we provide shelter to New Yorkers experiencing homelessness, irrespective of their background. All verifiable homeless New Yorkers have the right to shelter. The right to shelter is unique in New York. We're one of a few major cities that has a right to shelter. What this means is individuals are able to get connected to programs and services, that there's not restrictions on who and how people can come into the shelter. based on their background. They're able to rebuild their lives and get a second chance, as opposed to being out in the street. If you compare New York City compared to LA, you see a stark difference in the numbers of New Yorkers experiencing homelessness on the street compared to those in shelter who are connected to case management, housing specialists, substance use counselors, and other resources to get a second chance and to get back on their feet. We, in respect to sex offenders, I want to provide some information that I believe was useful on the call. We didn't have any follow-up questions, and so I like to think that we were responsive. So the requirement that a sex offender has to register is separate from that of the residency restriction requirement. The residency restriction is imposed by the state during a period of parole. New York State classifies sex crimes into 3 levels based on an offender's risk and a risk of committing another sex crime and the harm to community. Level 1 is low, level 2 is moderate, and level 3 is high. These risks are determined at the time of offender's release into the community and are individualized based on the case and the facts. Such offenders convicted of the same offense might receive a different risk level based on those individual circumstances. This level of risk also governs the type of information which can be released as community notification, and as well as the duration of registration with the State Division of Criminal Justice. And as a general matter, sex offenders under the New York State Sex Offender Registration Act, SORA, level 1 sex offender must register for 20 years, except with certain designations. Level 2 and 3 sex offenders are required to register for life. Separate and apart from this registration requirement are potential restrictions where a person can reside upon release into the community. These are oftentimes called residency restricted sex offenders. A person's status as registered does not mean that the person has a residency restriction. SORA does not restrict where a registered person may live. Rather, the state's residency restrictions are a component of the state's Sexual Assault Reform Act, SARA, and under that, restrictions are imposed as a condition of parole or conditional discharge. And this is where an individual has restrictions on where they might live, which includes the 1,000 feet from a school. I hope that provides some clarity in the difference between the requirement of an individual to register their address versus the restrictions upon where an individual can reside.
So is it the case that in the hotel shelters, there may be folks who are required to register but are not residency restricted?
That is correct.
Thank you. I'm going to shift gears and talk about, we've heard a lot of questions about aggressive behavior, and this is where we have a confluence of shelter clients and of street homeless. There have been a lot of questions in the chat about mentally ill folks behaving in a threatening manner, especially around women and children. There have been concerns about homeless encampments and the regular presence of non-shelter client homeless as being a part of the daily occurrence or experience on the street, and as well as verbally aggressive behavior toward women, and questions as to why they are permitted to remain. If you could please address what can and can't be done with respect to each of those categories of folks.
Sure, so I'll talk, and I'll certainly look to the providers who can fill in the work that they're doing in the community. We encourage residents who want to get individuals connected to our street outreach teams to call 311 so our outreach teams can come out. As I mentioned in my remarks earlier, these areas in the proximity of the shelter are regularly canvassed by our teams on a regular basis throughout each shift. This provides the team an opportunity to check in with the client, to engage with them, to offer them services. It is incumbent on the individual to accept those services. And that's what I think the community sometimes is experiencing. The frustration is that they'll see somebody on the street who doesn't necessarily change their circumstance. And so there's an appearance or an impression that they don't have a relationship with our team and that they're not engaging with the team. It can take hundreds of encounters for individuals to come in off the street. Under the course of this administration, we have encouraged individuals to come off the street. We have increased capacity of low threshold beds to ensure that individuals have a bed at the time when they finally decide to say yes to spend a night inside off the street. And we consider each step on that process successful. The administration has placed over 2,800 individuals who have been off the streets and remain off the streets from the start of this administration. And so we work with them regularly. I don't know if the providers also want to talk a little bit about what they're doing. We have made sure that both Goddard as well as the hotels have contact each other information for one another so we can have immediate responses. In regards to individuals who you feel might be threatening, I would remind you that if there is a threat of an immediate danger, you can call 911. But I would also remind us that individuals are experiencing any numbers of traumas and really challenging circumstances that the COVID crisis has brought on for them. Whether that be having to move from a location that have been previously housed in, the unsettling action of having to sort of reimagine what their life is like in a new location, is all stressful. It's stressful for you and I if you compound that with a substance use disorder, a mental health diagnosis. These are individuals who we don't know their circumstance. If you are feeling concerned and you feel threatened, 911 is an option. But I would also say that we walk past people every day and we avert our eyes, we cross the street. It doesn't have to be the way that we interact with individuals who are vulnerable. And I would encourage the community to call people in instead of calling people out, to figure out ways, and we've heard some of it tonight, how to welcome people, how to say hello, and make sure that we're being good neighbors on both sides of this conversation. I think that that's critically important.
Thank you. I'm going to pivot for a second. If Inspector Yaguchi could join us again, I'm hoping he's still with us. Inspector Yaguchi?
Yes, I'm here.
Thank you so much. There have been a lot of questions in the comments having to do with what we already heard from Dale Brown about the increases in patrols that were. Excuse me one second, something happened on my screen. Thank you. About the increases in patrols, especially around school drop-off and dismissal. But there have been a lot of questions about what to do when folks encounter, and I'm sorry, using words that I never thought I'd use in a community board meeting, but they encounter people masturbating, or they encounter people being aggressive and so forth. And also when they encounter people who are engaged in drug activity, either using illegal drugs or buying and selling illegal drugs. There's a lot of confusion about when to call 311, when to call 911, whether it's worthwhile taking a photograph or a video of that, and if so, what do they do with it? What can be useful to the police or the law enforcement and what is not? And then there are other questions having to do with respect to whether there can be searches of rooms of folks inside shelters. So first, with respect to 311, 911, and private video and so forth, what do you recommend? What is useful to the police in terms of enforcement and interdiction of crime?
So first of all, masturbation, drug use, you should absolutely call 911. If you feel like you're being harassed, absolutely call 911. That's what we're there for. So that's number one. In terms of the second thing, what is helpful to us, absolutely, if you're able to take photos or video of these incidents and do so in a safe manner, that is helpful to us, because a lot of the descriptions that we get, it includes a large pool of people, so to speak. it's hard for us to narrow it down unless there's like a specific distinct characteristic that they're able to provide us. So a video, photo, if you can do it safely. The last thing that I would want is for you to be taking a photo or trying to take a video, and that enrages this individual even further. And now you're putting yourself in danger of getting hurt physically. The third thing is we are not allowed to go into shelters and just start searching their rooms. That would be a violation of their privacy. Obviously, the shelter itself may have certain policies in place that would allow for that search, but we the NYPD, the government, can't just go in there and start searching their rooms.
Thank you.
I just wanted to quickly add to my colleague Aaron Drinkwater in regards to 311 reporting. I do hear this quite often from community members where they are frustrated when they reach out to 311 and they still see the individual in front of them or on the corner after they flagged it. One of the most helpful tools that I message to communities to utilize is the 311 app. As you're walking and navigating through the street, the app will actually geometrically ping your location. And within the hour, the outreach teams are dispatched to engage this individual. Why 311 is important is because it's a metric tracking system that our outreach teams heavily rely on. We constantly observe and monitor 311 to see where the new hotspot locations are. But it's also important for community members to know that after you flag that individual to us, the engagements do not stop. The outreach teams will continue to engage those individuals for services. Of course, a bed is our number one priority, but we also want to connect everyday New Yorkers, our most vulnerable population on the street, to care, services, and shelter. But to do that, we heavily rely on 311. So the app is something I encourage for folks to try to utilize. It also will update you in real time that, they'll say that you'll get a notification on the app that will let you know that it's been received, your flag has been received. It'll let you know that the outreach teams have been dispatched. It'll let you know if the outreach team, if they found the individual, if the individual flag was not observed or found. But just want folks to know that once that individual is on the outreach team's radar, the engagements do not stop. And so this is why it's important to utilize 311 so that our teams can continue to ensure we're connecting with every individual folks are seeing in the community who may be street homeless.
Thank you. Leilani, I understand that you very kindly, DHS kindly has agreed to continue on the call for another half hour. Is that correct?
We're here to answer community's questions. So as many questions as we can answer, the greater.
Thank you very much for that. I'll continue then with questions from that were submitted in advance. There were a lot of questions concerning homeless shelter clients as well as the street homeless, but especially shelter clients congregating in public without wearing masks and without social distancing. And there were a number of ways in which that question was expressed, including whether or not there weren't ways in which to enforce the requirement of wearing masks and so forth, and a question as to whether, if the purpose of moving them into the hotels and away from the congregate shelters was to create opportunities to interdict the spread of the virus, then isn't that defeated by congregating in public in close quarters without masks on? What can be done about better compliance with masks? And I'm not sure if that's a question for DHS or for the service providers.
So Erin, I think she may have dropped off. I'm happy to respond, and I think the providers can speak to what they're doing and proactively, operationally inside of shelter. But DHS has provided all of our shelter sites, including our street outreach teams, with PPE equipment. So as it relates to the street homeless population, our outreach teams have gone out. They do disseminate masks, hand sanitizers to our street homeless population. For those who may have not known, that's what that's one effort on the outreach, street homeless outreach side. As it relates to shelter, I do know that all of our providers are doing what's called house checks, check-ins frequently with our clients. There's signage inside of the hotels reiterating the importance for our clients to, be effective in practicing social distancing, washing their hands, wearing masks. As they leave sites, they're encouraged to please keep a mask on. But I think that this is a challenge citywide that we see with folks not honoring the mask protocol. It is a challenge, but it is something that I do know and can confirm that providers are constantly driving home to every client that walks out of the door of the shelter sites. I'm sorry, the commercial hotel sites. And if any provider would like to jump in specifically to touch on what you all are doing inside of shelter to ensure clients are being reminded on why it's important to wear face coverings as they exit the sites, please feel free to jump in. But I do know this is being reiterated at all of our sites. And when our outreach providers, the shelter providers, we are doing joint canvassing. So as they do external perimeter patrols, we have the providers doing that together so they can identify whose client is who. And if they do observe or engage anyone who is from the site that is not wearing a mask, the mask is provided. It is being messaged and asked of the individual to please wear a mask. If they engage anyone who may be street homeless, then that's a flag for our JCC teams, and we're coordinating in such a way. I hope that answers that question regarding masks.
Thank you. Thank you very much. I'm going to turn now to the COVID testing that was done recently. Is Eric still on the call? Or somebody from Project Renewal? Because there was reports that there were
I'm back, Chair Dillard. Apologies. I'm not sure
that there was recent rounds of testing. And the question is what, when someone did test positive, apparently there were some positive tests. It would be helpful to know how many, but how many tested positive? And then please explain what happens to the folks who test positive.
Sure. We did COVID testing 2 weeks ago. There was one positive result. The person was entirely asymptomatic at the time. He was immediately transferred to an isolation shelter, and so was his roommate as a matter of precaution. There have been no other positive results.
Chair, I'm happy to provide.
Are there any other positive results in the other shelters for the folks that are with us? I'm sorry, the
Sure.
hotels?
This is Daniel from HELP. We've had, as I mentioned in my initial talk, we've had in our second round, we had 0 positives among staff and clients alike. I also want to double down on what Leilani said about masks. You know, when I'm there, when our staff are there, we're reminding clients constantly as the weather continues to stay hot. I do see some clients when they walk out of the hotel taking their masks off. We remind them, but we cannot force them. We prod them, we cajole them, we use our relationship we have with them to remind them the importance of staying safe and all of that. And I do think there's been a lot of success with that, but there are limitations as well. I also want to say, and I want to address the sex offender issue very quickly. The Belclair, we have no level 2 or level 3 offenders, no residency restricted sex offenders at the Belclair.
Chair, I'm happy to provide more
thank
information
you.
if the community would like it in regard to testing and the city.
Anybody else? No, okay.
Can you hear me?
There
Can you
were
hear me?
Yes, we can hear you, Aaron. We can hear you.
Was the testing answer sufficient,
was
or would you like a
somebody
citywide response on the testing?
There were a number of questions about, oh, for heaven's sakes. There were a number of questions that were posed about the criteria for when populations will be moved back from hotels and why these hotels were chosen in the first place. There were suggestions, for example, that in a, there were questions about with families in a neighborhood of residents that were proximate to schools and so forth. Why was this population linked with these hotels rather than, say, families with children who are also experiencing homelessness?
Sure. As I mentioned in my opening statement, families with children.
Leilani, is that something you can answer?
Can you hear me?
No.
Can you hear me?
I guess we probably need Aaron for that.
Hello?
We are speaking. Can you not hear Aaron?
Can you hear me?
To clear,
I think
everyone can hear you except Mark. I'm one of the board members. So Mark, I don't know if you can hear me, but we can hear Ms. Drinkwater And I'm not sure if you can hear, but she's speaking. So let's let her speak. And I'm just trying to help a little help. We can hear her.
Thanks,
Okay.
I can. But go ahead. You're absolutely right.
So as I had mentioned in my opening remarks, the reasons why families with children population were not relocated is the type of shelter environment that those individuals are housed in. Family with children and adult families are located in contained apartments. Sometimes there's a shared bathroom, but it is unlike our single adult system in which there are dormitory style settings in which individuals anywhere from 4 to upwards of 16 individuals can share a room. Court-ordered settlements require that the beds are 3 feet apart. And therefore, this is a particularly vulnerable population because the dorm style setting doesn't permit for social distancing without the removal of some of the individuals, and some other providers then indicated or decided to do full relocations of their shelters. As I also mentioned, we entered into a contract with the Hotel Association of New York to assist with bringing capacity online quickly due to the urgent nature that we were faced with in terms of getting individuals out of those congregate locations into commercial hotels where they were housed oftentimes 2 or sometimes 1 to a room, depending on what the needs of the client are.
Thank you, Ms. Drinkwater. Mark, can you, I'm sort of an intermediate here. Can you hear me? Ms. Drinkwater's done.
Thank you. I am so sorry. I don't know what's going on with my audio.
I could be a middle person if you like.
That's terrific. Thank you. The next question, well, there were a lot of comments that came across with respect to the need for long-term affordable housing instead of additional shelters. I don't know that that's a question, but it should be shared because it was part of the many comments that were submitted.
We couldn't agree. We couldn't agree more. And one of the things that we did.
Can the service providers help us with what shelter clients need that the community could donate or provide? That was, I know that Mr. Farrell gave some details about that. Could the other shelters help us with for those that are so that ask those questions?
Yeah, Mark, I think Ms. Drinkwater had an opinion, and then why don't we give it to the other shelter, other providers? But if you wanted to clarify your thought, Ms. Drinkwater.
Steve, we need to hear from the service providers.
Okay.
Yeah, just,
this is
your thought, that's all.
Ronnie from HELP. I would just like to say one of the things that we could use is space that could be made available in the community to run small group programming. The Belclair does not have a lot of open space where clients can meet in small groups, both for recreation and counseling activities and remain socially distant. So if there are churches or synagogues or other institutional buildings that might be made available for use on a temporary basis for us to run those programs, that would be extremely helpful.
Ronnie, we have somebody from the community who's trying to reach out to you, someone from a local nearby church who's wanting to do just that.
Resurrection? Is it Resurrection Church or?
No.
No, okay.
Can you email me at helen@helenrosenthal.com and I'll connect you.
Wonderful. Thank you so much.
You.
Thank you. Go ahead.
I'll also speak for Project Renewal. As I mentioned in my remarks before, people have been dropping off individually packaged snacks, single ride Metro cards, books and games. We can accept those at the hotel. They are great incentives and rewards for clients to participate in programs, and they really appreciate the direct support that provides. I'll also say that the city budgets us about $7.46 a day to provide 3 meals and snacks for all of our residents. We supplement that with about $100,000 of additional funding because I think pretty much everyone here knows that it's tough to feed 3 meals a day and snacks for $7.46. So our social purpose enterprise, City Beat Kitchens, would certainly appreciate support to help subsidize that. Thank you.
And in addition to what Eric said, I would add that clothes are always, gently used clothes are always really welcome. The men don't really have a lot of clothes. And Metro cards, really use Metro cards.
Thank you. If Inspector Yaguchi is still with us, There were a number of questions about the guardian angels and their presence in the community, as well as about volunteer or citizen patrols or private security. Can you walk us through what is and is not recommended and what does and does not work with your work in law enforcement?
The guardian angels showed up. We had a shots fired on 99th Street and Broadway last Tuesday. They showed up to provide some extra presence. I know historically they've been around. It's certainly something that we want to be careful about endorsing too much. I mean, Citizens Patrol, it's not necessarily a bad idea in the sense that it's an extra set of eyes, but obviously where our concern is that when you're encountering more violent offenders, the safety issue of it. Obviously, we have a lot of tools to deal with that, a lot of training to deal with that, but it's a mixed bag. The idea of it doesn't bother me necessarily. I think it's good that fellow citizens are willing to look out for each other, but obviously it's not something that I can 110% endorse, given the dangers that are involved in it. It's certainly dangers that we worry about every day. So for me to sit here and say that, you know, you should go out there and confront these unpredictable, sometimes violent people, I think is I just have to be careful about that.
Thank you. We're getting close to, it's 8:45. I promise we'll wrap this at 9 o'clock. I want to give my community board colleagues an opportunity to ask a question or a comment. Again, please, on the brief side. Stephen, did you have one that you wanted to make?
Yeah, I wanted to follow up or make a brief, small statement and follow up on a question and hopefully get some clarity. And the statement I'd make is, and it has to do with the question, is the one criteria that I didn't hear that DHS was using was community appropriateness for certain areas. And I would really encourage that that be part of the criteria. You know, an extremely residential area like 79th Street to me may not be the best appropriate place for people with addiction challenges. And I have experience in that personally. And there's places in the Upper West Side that I think would actually be more appropriate. So it's not a matter of trying to push a problem on somebody else. I just think that's an extremely poor location for that particularly. And I don't think it does, I don't think it's well for the men either. But my question, hopefully, is to have clarity. Is I found you know, as a head of youth education and libraries, candidly, I found the question on the pedophiles very discouraging. You know, it seemed very legal, and maybe that's the answer that needs to be made on something like this. But I think it'd be good to get clarity, and that is one of the providers is willing to confirm if they had level 2 or level 3 people. And I'd like Eric or Tony, if they are willing to either say if they have level 2 or level 3, or they're free to say, I'm not comfortable answering that, but I think the community would like to know that confirmation. I believe Daniel confirmed that. I'd ask those providers if they're willing to answer that question.
Steve, we need to be a little bit careful that sex offenders are not necessarily pedophiles.
Well, a sex offender level 2 and a level 3 involves children, and that would be a pedophile. So those are the two that I'm speaking of.
Okay.
And that's the ones that I'm asking. So is Eric or Tony, can you answer those questions? And if you want to say I won't answer them, then that's fine, but I'd like to pose it.
I'll speak for Project Renewal. We have none. There actually was one who was listed in the registry, but it was not a true situation. The person was not with us.
Okay. And I think it was Tony. I don't know if anybody else is from that provider. No. I'm not sure if that's a no or a not answer or
I'm sorry. No, we don't have any.
Great. Well, then I think that it seems that we are hearing indirectly, and it makes me feel better that there are no level 2 or level 3s at these 3 areas. But I would say that
Same here.
I would say to our legislators that it seems to me that that was a very legal loophole-y type answer. And I would really ask them, you see how big an issue this is with everyone on here. I would simply say that a sex offender, level 2 or level 3 convicted, should not be allowed to live within 1,000 feet of a school, whether it's wherever it is. And it seems to me that there's a little bit of a loophole in there. And I would encourage our elected officials to work on that, because that greatly concerns me. And I'll leave it at that. I mean, that'll be my question, Mark. Thank you for offering me to go first.
Thank you. I think Shelley had a question. Am I correct about that? Shelley Fine? Oh gosh.
I saw Shelley get up, just so you know, Mark.
Okay. Yeah, my the screen is overloading here a bit with all of the traffic that's running through this. While waiting for Shelley, is there any other of my community board colleagues that has a question? You're gonna have to speak up because I can't see you.
Can I ask one quickly? For DHS, I feel like there's a perception from the neighborhood that the Upper West Side is really overburdened with the number of hotels and homeless individuals. Can you speak to whether that is actually true or just a perception? And like, are other neighborhoods dealing with this exact same situation? Can you give us any data on it?
Sure. So we have utilized 60 hotels as part of our dedensifying efforts. CB7 has 4. There are locations in Manhattan, community boards. 5 have significant numbers, community board 6 has significant numbers, Long Island City and Queens has significant numbers. These are all hotels that we've utilized to dedensify our shelters. I've seen comments in the chat as to why the agency isn't utilizing hotels in the outer boroughs. We are. Again, we're utilizing 60 hotels. Outside of the COVID response, the city was utilizing, I believe, 88 hotels right before COVID.
My audio is cutting out again. Is somebody
the
talking?
capacity needs.
Erin is speaking and we can hear her. You can continue, Erin.
Oh, just to say that we are utilizing commercial hotels outside of the COVID response, also in outer boroughs. I saw somewhere in the chat, why aren't we utilizing hotels out in near the airports? DHS has contracts and does utilize those hotels. So I do think that it is somewhat of a perception issue. I will note that there are 3 in close proximity to one another. There are other neighborhoods where that is the case. So I hope that answers your question.
Thanks.
Shelley, I think we were waiting for you for a question.
Yes. What was the question?
No, we thought you had a question.
I didn't ask a question.
Okay.
I have a question.
So, Linda.
Thanks. The question for DHS. I think what Melissa was referring to, and I think what we feel a lot of is that it's not just the COVID situation. The Upper West Side has been an area that has had a lot of shelters over the years. DHS surreptitiously moved them in 2006 and 2008 on West 94th Street. We've been experiencing this from DHS for many, many years. I think one of the reasons why, and I think that was Melissa's question, how many shelter situations and SRO situations, SROs do we have on the Upper West Side? We seem to be a repository for many, many, and we have been for the last 20 years.
Sorry, Linda, that was not my question, so appreciate you not speaking for me.
I thought it was clarifying, and I'm sorry.
Thanks.
I'm sorry.
Looks like Shelley does have a question.
Yeah, now I have a question. There was a history for a long time of DHS not contacting the community. During the Bloomberg administration, I met with the mayor and he said he would give 30 days notice as a policy. Now, granted, there was an emergency situation, a medical situation here, but the fact is the decision was not made in one day. So I think that looking forward into future relations between the community and DHS, that we should expect that there be some level, some time period before, while DHS is planning a move, that there is some consultation with elected officials and the community board and the affected community. So I'd like to know from DHS, is that their intention moving forward? Because certainly this situation that we have, the negative parts were exacerbated by the lack of notification and consultation.
Sure, I understand that. The use of emergency hotels, you said it exactly. That
Again,
the
I'm not
city
hearing it. Is there an
was
answer being given?
operating in an emergency to respond to this. We did provide calls to our elected officials and to the community board. I understand that from the community's point of view, it was not enough time. We have been in ongoing communication and conversations with the community to have an open door, to be able to be responsive to feedback that we've gained from those conversations, to create meaningful and productive relationships with the neighbors in the immediate vicinity and with neighbors across the district, and hope that continued conversations like these will allow us to continue to be responsive.
Thank you.
Okay, so are we back on?
Yes.
Thank you. So I realized that I cut off Linda's question before it got an answer. So I apologize for that. Linda, do you want to pose it again? And was it a question or was it a statement?
No, it's a question. I mean, it is a question and a statement. I misunderstood Melissa's question. I thought it was relative to, we have a whole history on the Upper West Side, as we know, of being, and we've been very, we've embraced a lot of the shelters, a lot of the shelter populations. But I think one of the things that, made everybody so angry, I guess it is a statement, and really brought the community up in arms was the fact that once again, we had a population without any free notice. And I understand the emergency nature of this situation, but we've got a whole history with DHS dating back to
yes.
And Seth Friedman and all of your predecessors.
I understand the historic context here and the frustration. I will say that in the context of our permanent shelter sites, the mayor made a commitment under the Turning the Tide plan to open 90 new shelters. We have announced on 70 of those shelters, 39 are currently up and open and operating. Of those 70 shelters that we announced on, we have made a commitment to provide at least 30 days. We are currently providing over 100 days notice. And that is for our permanent shelters. And that is a commitment that we made and we have stood by. My team makes those calls to our elected partners, to the community board, to the precinct. This was not that circumstance. And again, I recognize I am empathetic to the frustrations of the community, which is why we're here tonight, why we've participated in other meetings, to hear from the community and really be partners. On the question of SROs and other issues that the Upper West Side feels like it is handling more than their fair share, I will also say that, opening up permanent housing is exactly what we need to solve the homelessness crisis. Under this administration, we've moved 147,000 individuals out of shelter or have avoided entry into shelter. That includes about 1,500 plus individuals over the course of the pandemic because we've been able to utilize remote viewings of apartments, but we have not stopped moving people out because of the pandemic. We know that a permanent place is the best option for people, but we also know that we have to work in partnership, that we all are working towards a day where I no longer have a job working to provide information to communities around homeless shelters. But homeless shelters are often like ERs,
okay.
Right? It is something that we
need. It's 9 o'clock. I see there are additional hands raised, but I think it's probably time, especially given the technology challenges I'm having. Maybe one last question.
Mark, I'd like
Robert,
to ask a question if possible.
well, okay.
Robert was waiting for much longer.
Let Robert, and then Doug will get the last word.
Okay, yeah, thanks, Doug. So I'm really repeating the comment that I've made before, and I was very happy to hear that one of the earlier comments by, I think it was the clergyman, about 20, 30 minutes ago, that suggesting the very same idea, so that we don't know 2 months, we don't know 3 months. We know that we have a population of human beings that are among us and that they've been among us for a while. And I think that what we should be doing, and I'm a great believer on this concurrency. You don't do one thing at a time. You don't, you walk and you chew gum at the same time. And that a good number of the people that are new neighbors have skills and they have worked. And of course they've run on bad times and they're out of work, they're out of home and so on and so forth. But I can assure you that whether we're talking about the Lucerne or the other facilities, that there are people who are able to work and that are psychiatrically stable and that are willing to work, and that we have agencies, whether we're happy with their behavior toward the community or not. DHS is a behemoth of an agency and they have everything you need. And so we have assessment tools, we have ways of knowing who can work and what skill they have and how to help them take a step up. And that, and we have a local infrastructure. We have local chambers of commerce is very active. We have our local business district. We have two of probably, here I go. We have, I'm a little chauvinistic. We have two of the business districts that are probably the strongest in the city. And that why are we not creating a matching program that we would sponsor? We play a role as the advocates where we canvass our new neighbors to see, what do you have? Were you a carpenter or whatever? Because in the new model that we're pursuing, and I hope it stays, Gail, of hitting the streets, and I'm eating out. I don't know where I'm getting the money from, but I'm here at my favorite haunt across the street because it's so near. Rancho Tequileria. I just, they're gonna have to throw me out of there. And there are all kinds of jobs because you now have a new configuration. You have new needs on the street. These human beings can do the jobs, whether it's cleaning, whether it's busing, whether it's whatever it is. And that I think that instead of just complaining that, what are we gonna do with the guy that is masturbating over here or that is defecating on the street? That's a psychiatric issue. These are definite psychiatric issues, and to a certain extent, psychiatrically criminal issues, and they have to be addressed. So that's another failing of the system. But for
okay, Robert, I'm gonna have to speed you along here a little bit. Because
I think you get my point, Mark.
Yeah, thank you.
Get your point. We should be aggressively, thank you, Jay. We should be aggressively working to get to accommodate our new neighbors.
Very good. I understand, even though my technology is now limited, Irena has had her hand up before other folks, so I'm going to call on Irena. Please keep it for just a couple of minutes, folks, because we're just about over time. We are over time now. So please keep it short. And then I think it was one of the Dougs and Jay.
Thank you, Mark. I really appreciate it. I've been on the call since it opened, and I just couldn't get into this room. But I want to thank all the service providers that are on this call. And I just have one very brief comment. I've been on the Upper West Side probably over 30 years, and I worked for Community Board 7 when Sally Goodgold and John Kohler were the chairs of this board. And I just want to remind everyone on this call, particularly the service providers, that the Upper West Side has a history of developing supportive housing before anyone even knew what that was. And so I want to say that because I don't want people to walk away from this call thinking that we are not empathetic and sympathetic and we don't understand the plight of the homeless. SRO Law Project started on the Upper West Side. There was far more supportive housing, homeless shelters on the Upper West Side than any other community district. And I really just want to emphasize that. Secondly, I want to say that the COVID numbers, the increase in COVID has been for the past month below 1%. I am perplexed, to put it mildly, why Miss Drinkwater and why DHS and the mayor cannot tell this community and every other community when they expect for the homeless that have been placed in this community to be returned either to a shelter or to other facilities. I feel like something else is going on because we're not getting an honest assessment of a timeline. And I think it's critically important that we get that timeline and that the public officials may put a pressure on the city, on the mayor, on the deputy mayors, on Steve and everyone else involved to give every community a timeline. This idea that we don't really know is, I think I'm suspicious of it. So I just want to say, I think we're entitled to a timeline when the homeless will return to to the homeless shelters, since the number of cases are going down and we're not seeing an increase in spread. Thank you.
Thank you. We're going to take Doug McGowan and then Jay Adolph, and then we're going to call it a night.
Thanks, Mark. I'd like to just echo Arena's comments. There are clearly a ton of community concerns here. Lorena, Yuri, and some others expressed them very well. Although the meeting has been a good first step, what's the next step for the community leaders in addressing our concerns? To whom, how will the issues be addressed? And I think Adam Herbst made the comment, it was a good one, that a task force of some type be assembled to address these concerns. So can you communicate to the public what's next?
From the community board standpoint?
From the community board standpoint and or from our elected officials?
Well, the DHS has agreed to work on a small group meeting that the community board and others are a party to. I will continue to work with them and involve our colleagues from various committees on those calls to make sure that we follow through on the upkeep and update rather on those matters. We can beyond that, we can absolutely work with our elected officials to develop other ways of following up. Right now, I'm actually a little bit blanking on what all of them might be, but we're not. This is our first community meeting on this. There have been smaller group meetings, and they will continue, and we will continue to try to address all of the issues as they come up. There are some that are particularly thorny and hard to solve, as you heard tonight, but we're not by any means one and done with this.
Thank you.
I'd like to work with you to develop some of those things. I realize that I called on Doug McGowan when I should have called on Doug Kleiman, so I'm going to call on Doug Kleiman, and then I'll give Jay Adolph the last word.
Real quick, I appreciate everybody being here and for such a protracted amount of time. And the service providers, this is probably for you, perhaps DHS. Since so much of the concerns in the neighborhood are of safety and potential criminality, obviously being homeless is not a crime. And I think I've been in this neighborhood my whole life, and I think this is a very compassionate neighborhood. And I wish every single resident the best and in their sobriety, in their recovery, and in their housing. The question I have is, under what circumstances, however, would a resident be removed from any of these residents? I hear about a friendly neighborhood policy. I'd like to know if a resident is arrested for a crime in the neighborhood, and that is confirmed, not alleged. I realize there's various levels of crime, obviously, but what are the internal rules? I understand sobriety is not a rule, and that would perhaps be in a rehab center, but not in a shelter. So if the service providers could just speak to that, under what circumstances would a resident be removed? Thank you.
Mark, I can speak to that really quickly on behalf of Help at the Belle Claire. Our threshold is very low, and we've been doing this since day one. We set the tone with our clients from May 2nd, that we've had an issue at the beginning with some clients smoking in their rooms in the hotel. They were sent back to their shelter of origin. We had folks outside that were, if they were engaging in any sort of inappropriate behavior, public intoxication, anything along those lines, we sent them back to shelter. And we've continued to do that. We've sent dozens and dozens and dozens of clients back to shelter. Now, like I said from the get-go, we have a third of our clients are women. We tend to see less problems with women, but also I just lastly want to speak to many of our clients are working. Many of our clients are doing well. If we're going to talk about 700 folks at the hotels, we should talk about the full depth and breadth of those 700.
We already have.
The majority of those folks are doing well. That's all I'll say.
Thanks. Does any other shelter provider want to get in on that? Because this is an issue where we confront that, because there are surprises that, for example, active drug use is not sometimes an experience that causes them to be transferred to someplace else. Can someone speak to that as well?
I'll answer for project renewal, and then I might ask Kadon to jump in if he has something else to say. We've transferred 18 people in the last 4 weeks out of the Lucerne and back to shelter or to other locations, either because of repeated unwillingness to abide by the good neighbor policy, or because they simply, weren't willing and able to function well in the hotel environment. One of the challenges we face, and I'll be honest about it, is that we think everybody is better off when people are staying in shelter and receiving services, as opposed to being out on the streets and completely unsheltered and unsupervised. So it's a little bit of a judgment call, and it's one of the reasons why I'm so proud of our staff, because those are not always the easiest calls to make. If we transfer someone, they're going to another location. We have definitely found that our clients appreciate being in the hotel, and most of them, the vast majority of them, are working pretty hard to make sure that they get to continue this. Helen just asked me if there had been any arrests of a client. There had been 3 arrests at the Lucerne since we came in. One was for taking a city bike that someone didn't dock. One was for taking a package out of a building. And I believe there was 1 drug arrest. Charlie and Kadon can confirm that. And yeah.
And I would just add that if obviously if somebody commits a crime and the NYPD removes the person and takes them to jail, that's the end of that for the shelter. We've had people who have been arrested, but also if part of what we do is provide treatment. So and sometimes people's behavior is due to mental illness, and we try to address that mental illness. But we also will work with DHS if the person's not a fit for the setting, or the person's getting in trouble with other individuals in the shelter, or then we work with DHS to transfer the individual. And that's, we try not to do that, but it does happen. And we find DHS very cooperative around that.
Very good. Thank you. So that's all 3. Jay, I think you get the last question, and then we're going to wrap this up.
My last question, Mark, are your first 2 questions, which we didn't get an answer to. So I echo Irana's concern, and I ask Ms. Drinkwater to just give us a projected timeline as to when the pandemic motivated moves will be undone. And the second question, I would like a yes or no answer as to whether this administration has any intent to make any of these hotels a permanent homeless housing. Yes or no?
Sure. I'm going to try again on the move back to congregate shelter question. I know that everyone hears it as a non-answer, and I really am sorry for that. It is reliant.
Well, instead of a non-answer, why don't you try giving us an answer?
Jay.
Unfortunately, I don't have a crystal ball here. This is reliant on data. This is reliance on medical experts. It would be a terribly unfortunate circumstance to rush and move everyone back into a congregate location because of the current city infection rate, only to have a second wave come and hit us in the fall and have to relocate 10,000 clients back to commercial hotels to protect them. I understand that it is frustrating for the community. We have come here tonight. We have come here to talk to the community board and other elected stakeholders to provide information. We are living in a time where there's a great deal of uncertainty, and we are working tirelessly along with our providers to try to help those who are most vulnerable, who are living in congregate dorm style settings where there are 4 to 12, upwards of 16 individuals in a room. That is a recipe for disaster. There were headlines early on about a ticking time bomb in the shelter. We mitigated that risk and saved untold numbers of lives. I understand that it is frustrating. I cannot give you a date certain today. What I can commit to is regular communication with this community and any other community who is asking for information. Mr. Adolph, on your question in respect to, does the city have any plans to make these permanent shelters? Not at this time. No, is a yes or no answer.
I could continue the discussion, but,
Yeah,
but
no,
we're done.
Yeah, we're done. So I think it just falls to me to say thank you to everybody for participating. These are very difficult issues. We will, of course, as a community board, continue to work on them. The community will obviously continue to work, our elected officials will as well. We are grateful that the Department of Homeless Services and the 3 service providers stayed on 45 minutes longer than they proposed to do, and provided answers that were very important for us to hear. Obviously, providing answers and providing the answers we want to hear are different things in this context, but this is engagement that we did not have before. I obviously have my own thoughts about about how the community ought to be informed and be engaged early on. But here we are doing this work, and I'm grateful for all the participation of everybody to try to make our situations better. With that, I'm going to, unless there's anything I'm missing or forgetting, I'm going to say, we will save the recording of this. We will save the chat. The chat probably numbers in the hundreds of pages at this point, so it may take us a little while to post it and to vet it and make sure that the questions that are raised in it were answered in one fashion or another here. But that will be our next work going forward, and we will continue to engage on this issue. With that, I'm going to say thank you to all my colleagues and for all the participants in this meeting, and wish you a good night.
Thank you, Mark.
Good job, Mark.
Thanks,
You're
Mark,
very kind.
putting this together.
Thank you very much.
Thank you, Mark.
Thank
Very
you,
good
Chris.
job, Mark.
Thanks, Mark.
Well
Good
done,
job.
Mark.
Thank you, Richard.
Well done,
Yes.
everyone.
Yes, thank you. And thank you, Borough President,
Thank
for
you.
the extra 1,000 people.
Thanks.
Mark, contact me tomorrow so we can work on the chat.
Thank you, will do.
Thank you. Thank you, Mark. Thank you, Gail.
Thank you,
Good night.
everyone.
Good night.
Good night, everybody.